Okay, thank you. Find you another. Started in just a minute when everyone arrives. Good evening. It is Monday, September 13th, and I'm calling this work session to order. I'd like to remind everyone to please pull up your masks. You won't be able to stay in here with your masks down. It has to be up over your nose. Thank you very much. Orange County Schools Board of Education pledges to our families, students, staff, and the greater community to conduct our business in a courteous and productive manner, showing respect for fellow board members, staff, and citizens. The board asks its citizens to conduct themselves with the same courtesy towards all staff members and each other. As per board policy, Robert's Rules of Order will be used to conduct meetings, and a moment of silence will be observed before we begin our business. Public comment will be held tonight after the presentation for each agenda item for which a speaker is signed up. As we begin our work this evening, I ask that we remember that OCS educates our students on the traditional land of the Occaneechi Band of the Supplemental Nation and reflect on building an authentic community who works honestly and transparently to repair generations of harm. We will now have a moment of silence. Thank you all so much. Dr. Felder, I will turn it to you for recognitions.
Madam Chair, I'd request that since we are at a school, that we have the opportunity to recite the pledge.
Well, we'll have to vote to put that on the agenda. Since it's an added agenda item, we would have to have a vote. So if you want to call for a motion, you're welcome to.
I motion that we recite the pledge since we are offsite at a school site.
All in favor?
Aye.
Aye. All right. Guess we will do that now. Flag over there.
Pledge allegiance to the flag of the United States of America, to the republic.
Dr. Felder?
I thank you, and good evening, Chair McKenzie, the entire board, students, staff, and families. Tonight, we have several recognitions. Tonight, we want to inform some and remind others that September, next slide, please. Tonight, we want to inform some and remind others that September is National Suicide Prevention Awareness. Suicidal thoughts, much like mental health conditions, can affect anyone, regardless of age, gender, or background. In fact, suicide is often the result of an untreated mental health condition. Suicidal thoughts, although common, should not be considered normal and often indicate more issues. The month of September is a time to raise awareness on this stigmatized and often taboo topic. In addition to shifting public perception, the National Alliance on Mental Health Illness uses this month to spread hope and vital information to people affected by suicide. If you or someone you know is in an emergency, call 911 or the National Suicide Prevention Lifeline at the number on this slide, which is 800-273-TALK-255. Staff and students may also use the Say Something app to make anonymous report out of concern for another individual. Next slide, please. So September is also National Hispanic Heritage Month. Each year, Americans observe National Hispanic Heritage Month from September 15th through October 15th by celebrating the histories, cultures, and contributions of American citizens whose ancestors came from Spain, Mexico, the Caribbean, and Central and South America. Here in Orange County Schools, our community engagement team of family liaisons and family outreach coordinators are planning weekly opportunities for Hispanic students and families to engage with experts on important matters. Topics of exploration include education and scholarships, food and housing security, healthcare, policymakers, and legal support. and Hispanic Pride. More information about these events is coming soon to our district website, so eye on our homepage in the coming. Next slide, please. This is a new element to our each board meeting. We want to highlight, shine a spotlight on staff, schools, students, community members, being of support with regards to safety and health. And so this month we want to highlight our school nurses and staff who supported the district by manning a call center, transportation call. So since the onset of the pandemic, Orange County staff have gone above and beyond the call of duty to keep students safe, whole, and learning. So tonight, we shine a special spotlight on two groups of staff. The first are our school nurses and our lead nurse, who we can never, ever repay for the extraordinary and very difficult and exhausting job they are doing. As one nurse said, last night I worked from 7:30 p.m., this is after full day's work, 7:30 p.m. to 11:30 p.m. Follow-up, data entry, and communication on 15 new cases I got yesterday. This did not include the 6 to 9 students who I saw at school that day in support of their needs, while also trying to care for the usual medical needs of students that I am mandated to address. We want to recognize them and to also provide additional support for our school nurses. So you'll hear more about our staffing requests that we are seeking approval on tonight. The other group of staff are our staff from across departments and a transportation call center. They're responding to as many as calls during the first 2 weeks of school. These staff took on additional work on top of their normal to ensure excellent customer service to schools and families. So at this time, I'd like to invite Mr. Patrick Arvel, Deputy Superintendent of Operations, who would like to share some additional comments about these amazing. Mr. Arvel.
Good evening, members of the board, Dr. Felder, and those who are with us this evening. Just wanted to say, as Dr. Felder mentioned, the beginning of the school year we know is a very tough time, especially when we're opening and trying to get our operations back in gear. Last year was certainly a challenging year for all of us in having our full transportation operations open for students and families presented quite a few challenges. As our transportation department worked effortlessly and around the clock leading up to the opening of school, we put together a call center, much like was put together during the initial days of the pandemic to respond to the needs of the district and the community. And that call center was staffed every day, 7 a.m. to 11 a.m. We had no less than 5 individuals from all departments and areas across the district supporting the call center, taking in phone calls. We even created a school bus status board that was shared electronically out to the schools. So the moments we knew there was a transportation issue with the school bus, we could communicate that to families that were calling. Could also get an updated status, whether that was by radio. We had online communication with our transportation department, certainly phone calls as well. So we were trying to get information very quickly back as to the status of buses. And then the third thing that was critical was we were assisting families who may be new to the district, or families who had moved, or families who had put in a transportation request and for some reason it just didn't show up. So we tried to make sure we were responding to those families, getting those students routed and put on school buses. As Dr. Felder said, aside from answering the phone calls, the transportation staff added about 1,000 students to bus routes the first 2 weeks of school. And so a tremendous amount of work. We learned quite a bit. We'll be putting certainly best practices in place for next school year, and we will have a call center that will for next fall as well. But just wanted to give you an update that those individuals did provide a very valuable service, and at many times they were leaving the work of the department or other areas of their responsibility to assist with the transportation. Thank you.
Much. With that, I will ask if we have a motion to approve tonight's agenda with the addition of a discussion about a tool supplement under item 5.
So moved.
Second?
All in favor?
Aye.
All opposed? Passes. Okay, so now we're on the consent agenda. I need to pull the August 9th revised minutes because I was not in attendance at that meeting. Are there any other items that need to be pulled, or do I have a motion
Yes.
to approve?
I would like to pull the August 16th and August 9th minutes as well.
Okay, so
And I'll tell you why. I'd like to pull them so that the board assistant can cut and paste the personnel report into the minutes.
is that for all 3?
Yes.
Okay, so we'll just put, we'll have to have 2 votes, one for August 9th and 16th. 3rd. Okay, do I have a motion to approve the remaining items aside from the minutes on the consent agenda?
So moved.
All in favor?
Aye.
Opposed? Okay, the bulk of the consent agenda has passed. Do I have a motion to approve the August 9th minutes with the addition of the personnel report being pasted in? There a motion to approve? I just pulled them because I wasn't there, so I don't want to vote on them. There
Oh,
wasn't a
okay.
problem with them.
Oh, okay.
Sorry if that wasn't clear. Is there a motion to approve the August 9th minutes with the addition of the personnel report?
So moved. Second.
All in favor?
Aye.
I'm opposed only because I wasn't there. Okay, August 9th minutes are approved. Do I have a motion to approve the minutes from the 16th and the 23rd with the addition of the personnel report pasted into them?
There were a couple corrections that we emailed about the August 16th. I don't know if they got adopted.
Were they,
Okay,
Okay.
we're going to pull them then?
We'll just pull them.
so we'll just vote on them
Bring
at
them
the
back
next
to the
meeting.
Bring them
Okay,
back to the
very
next
good.
meeting.
That sounds
Great.
good. Thanks, everyone. Okay, with that, we will move on to our first agenda.
All right, good evening again. Patrick Albley, Deputy Superintendent for Operations. We have several updates to bring back to the board this evening in reference to how we're responding to COVID-19, but also how we're operating and the health and safety measures that are taking place just at the start of a normal school year. Certainly know that the amount of time we have this evening, we won't all elements and individual items covered in depth, but we additional time for items and thorough discussion, especially when it comes to a couple of the items. I do have several staff members here this evening. They're also going to help present information and share information. First item was our outdoor meal plans and supplemental sales, and we have with us Mr. Jarwin Hester, who's our Environmental Health and Safety Director, Sarah Pitts, who's our Director of Child Nutrition, is going to give
briefly about our current plan as it exists now, and also let's also talk about the safest strategy we looked at for our meals outdoors. I think common districts in most lunch and safest meals. By this is we're consuming meals out. We're giving the students that 15 minutes to actually consume those meals, locating it in those safe areas outside, and including that we're kind of away from those playground access areas. So unless there's a significant rain event or unsafe weather event, I have all of our meals conducted, that's breakfast, lunch, and snacks, outdoors. The classes should remain together during those meals and snacks. And what we're looking at is having those seatings, benches, and tables where students should not face each other. What they're doing is they're facing direction, straight direction. In addition to that, they're having their mask on, unless they're actually dining. And that's 15 3-foot apart or greater. And that space is safe and a picnic table style eating, which occurs on mapping. As those meals procedures that should be followed, they're consuming. If they're in classrooms, they have those lunch and snacks. Again, they'll occur only if there's some form, in this case, inclement weather, lightning, like. But our expectation is to have all students. Now, in those spaces, they're still going to have that 3-foot minimum, to the greatest extent possible. Students should not face each other as well. Should have those air purifiers. Definitely is a good tool to have those air purifiers on as well. Acceptable distance so we can have those air circulating in. Now, if there's meals should be consumed in shared spaces, the options are selected to have them, again, it's having them indoors, but we also want to have those students rotated, those larger dining areas, cafeterias, and have that space at a minimum of 3 feet at any time. And again, those students' spaces should not sit facing each other, away from each other, and talking. Areas should be properly cleaned and disinfected. Clean those cohorts of students. In addition to that, the disinfectant should be directed. In addition to keeping those contact times. This is just a brief summary of those expectations and dining areas too as well, and I'll pass it on to.
Everyone, and thank you for your time. The North Carolina State Board of Education and Department of Public Instruction, in consultation and response to guidelines issued by North Carolina Health and Human Services, developed guidance to support public schools in determining their plans and strategies for reopening. The Lighting Our Way Forward document provided clear, actionable steps to help limit the spread of COVID-19. The initial guidance limited the student density in a facility, restricted commingling of students, required food items to be prepackaged, grab and go, and limited the sale of supplemental food items, including. To comply with this guidance, Orange County Schools included in their safety protocol meal options to best meet the needs of our students in an environment that promoted optimal, not optional, social distancing, which included grab-and-go meals that could be taken outside. The need to provide nutritious meals for our students has never been. Child Nutrition will continue to work with the Director of EHS and school administrators to gradually transition from the current options to cafeteria-style meal service, based on the requirements for social distance, personal hygiene practices, and other. Currently, each student is eligible for 1 free breakfast and lunch per day as part of the Seamless Summer option in the National School Lunch Program. To be reimbursed per meal, the Child Nutrition Program must serve breakfast and lunches that meet the federal meal pattern and portion size requirements as set forth by the USDA. All lunch meals must consist of 5 things: grain, a meat alternate, a vegetable, a fruit, and a milk or dairy product. In order to meet the reimbursement standard requirement for a meal, a student must select at least 3, which is meat, a veggie, and a fruit, and a Child Nutrition is working hard to ensure that our students are fueled by nutritious to sustain them throughout the day. But meeting this goal is going to get extremely harder in the future. Daily, we receive notifications from vendors and suppliers warning that our supply chain issues, product shortages are greater than they anticipated in the beginning. Shortages mean that food ordered to cook the menu items posted may not show up when the delivery truck arrives, and in most of the time, we aren't given previous. So our child nutrition staff are thinking creatively to make sure that our students get a well-balanced meal that meet federal standards. Menus may have to be adjusted as a result of the shortages, and notifications will be posted to site administrators and families. Orange County Schools is currently reviewing additional options for meal service, including kiosks with grab-and-go meals, other areas besides the cafeteria, alternate daily entree and veggie options in the event that a student does not like the menu, and the option to open supplemental sales. Updates for our plan will be given to the board as soon as they are made.
It's not, I'll recognize you when it's time to speak.
Hey, good evening, everyone.
Good evening.
Chair, Ms. McKenzie, our board. Thank you for the opportunity to debate. Every department in our department, extra hard. Weekends.
I just want to let everyone know that you are the Director of Transportation.
I'm sorry.
No, I just want everyone to know how hard your department's working,
Oh.
so I want them to know who you are. This is Mr. Larry Albert.
Thank you.
Yes.
So our department's been putting it in hard as we can go. Give our Orange County students opportunity to. As of today, we're transporting 3,477 of those awesome Orange County students. Doing this with 43 buses, 66 routes. In comparison to the 19-20 school year, 59 buses, virtually the same amount of students. See the obstacle. Keeps us from being consistent with our times. I could go on and much it affects what we're trying to do. We're doing so much more with it. That's just kind of where we are moving forward. We're trying to make it more appetizing for people to come work for Orange County, our buses, work for our department, work for the time. Is there my questions?
Smiley?
It's actually just not a question. Mr. Albert, I just wanted to thank you and your team. It seems incredibly challenging. It's really, really hard work. And that goes for all of the previous comments as well, for and the as well. So.
Evening again. See everybody. Glad to see everybody's got their masks properly. I'm here to talk about our masking compliance, masking checklist. And that's one of the great tools that we use as a mitigation strategy to make sure, and again, to enhance in this case, our preventative measures to make sure everything is working, functioning properly, nature of this COVID. So I want to take a minute to discuss our masking compliance checklist. For everyone here, the district has been scheduling, ongoing now, some time, evaluation checklist. It's a checklist that is been developed to have staff go from room to room. We're looking at a weekly check, 15-minute check inside of a room, at least 2 classrooms a week. So in about 15 minutes, walk in to actually report and determine from the observations how staff and students conducting themselves as far as compliant, wearing masks. For this compliance, it was looking at who's wearing a mask, who's not wearing a mask. As such, are they snugly fit around your face and nose? And at times, kind of looking at it from a purely observational standpoint to look for those areas of concern, improvement, compliance. So wearing a face mask, or in this case, covering and maintaining that physical distance, all prevention strategies that we're using to help reduce the spread of COVID. So as far as the data points are, and let me kind of go into those, we've conducted from August 23rd to current over 107 inspections, total inspections, from all the schools listed and outliers such as maintenance and transportation. From that, that's a total number of students for 2,096 students were surveyed. Number of adults that were surveyed, those are teachers, 235. Out of that, we count for no adults that didn't have a mask on during. We had 12 students that didn't have. We can attribute that to several things. One, we have a exemption. We have some other situations where a student was coming into the building, and so on. So those are actually explained in our comments, and I kind of those determine one, nature of it, and if what action need to be taken further with that. Those, in addition, adults observed non-compliance, and those students that are non-compliant. Out of this 2,096 surveyed, we had 20 adults that were non-compliant, and what that means is that in this case, the mask was under the nose, and it wasn't fitting properly or wasn't worn properly. Those were situations, and all these, where we say non-compliant, with the student non-compliant, adult non-compliance, they were discussed for these observers to say, hey, you wearing your mask improperly, please put it on properly. In addition to that, if some assistance or guidance, we're using the time as a teaching tool to explain definitely best processes and styles to do that. As far as that goes, we had 20 adults that were technically non-compliant. That means the mask wasn't fitting properly. Children, it was about 51. Speaking to this particular subject, these are data points that I'm telling you tonight. And what I'll do is I'll send you an update, much more detailed update. Anyway, any other questions, comments? Yes, ma'am.
I have a couple questions. First, I'm getting notes that there's some problems with people listening remotely, getting the sound, so I don't know if we're working on that. Thank you on the mask compliance. I'm not sure there's anything that's more important than this that we're doing in school. So I have just a couple questions. One is, if a teacher or student sees somebody on a day-to-day basis that's not compliant, what do they do to create compliance? That's just a couple questions. Secondly, and I think this is especially in our elementary schools, I'm hearing that our kids really need to change their masks because they get kind of funky, maybe a midday mask change, and I'm wondering if we're encouraging or even creating a regular process asking for a mask change in the middle of the day for our younger students.
Okay. I'll handle the second one first. The student mask change, we're offering students an opportunity to actually, in this case, go out and get these rates and actually walk around outside to actually mask. In addition to that, we have a number of masks that are available to these students to change out those masks. Found locally, in this case, really available. Vigorously going out and actually establishing masking stations of the building. So when you get out of your car, as soon as you walk through that door, there's a mask. Always there, find them throughout the buildings. Gives them an opportunity to, if they, for some reason, the mask gets sold. Class can come. Teacher or student or adult that expect you to classrooms to it. And what was your first question, ma'am?
First question is, what about every day? If a teacher or a student sees someone who's not compliant, what do they do?
In this case, they can notify if a student student not, in this case, compliant with that, the first thing is to go to an adult, tell them, and they higher level, and bring it to the attention of a particular teacher and or student to have it resolved. So at first it starts off as a learning, coaching, teachable moment. It continues on, it can escalate even higher to potentially a written notification and like. These are just, in this case, we want to get compliance. I think that's the main thing, kind of pushing this as an opportunity to, one, check to make sure, see where we are and in the schools. And then secondly, if necessary, take additional action to determine and make sure we can find ways to maintain that compliance. So there's means for that. In addition to, there's a in case of numbers that can be used, exactly, hey, phone number, let's call it and notate that. But the best tool is to see it and say it immediately so we can have these items resolved. One of the best tools. Somebody with that, directing folks to principal or comment. And I'm in the building or others in the building, that's the first thing they note. Hey, for a lunchtime period, hey guys, let's go see if we can get our masks on. Again, when you're walking in the hallway, sometimes you're, hey, let's together, they're going to the restroom, in and out, making sure that you're actually using it. If they need replacements, we have them.
Other comments, questions? Thank you.
Oh, my name? Oh,
All right, just on a mic check here, I think I understood that there were some microphone issues here, so I'm just making sure folks can hear. We have with us our lead nurse for the district, Ms. Sylvia Compton. We're going to cover 3 items: contact tracing, the process, quarantining, and support for school nurses. Really going to tie contact tracing and support for school nurses together, because as you will hear, that's where we're spending the majority of time with nurses right now. Thank you.
Good evening, everyone. So yes, I'm Sylvia Compton, lead nurse for Orange County Schools. Thank you for having me here this evening. I'm going to pass around a quick little to look at interview form that we use as nurses to kind of get the basis of what we do when we do contact tracing, so you guys. Short, sorry. So with the contact tracing process, we definitely follow the guidance with North Carolina Strong Schools Kit, K through 12 toolkit, which comes to us from North Carolina State of Department of Health and Human Services, along with our local health department guidelines. They have final say on what we're going to follow out of that toolkit, as well as they can have variations and changes and additions to that as well. They are also case-by-case basis if a couple of things do overlap and we need, so it may change as well on a case-by-case basis. The biggest thing that we're following are the symptoms that are now listed within Strong Schools that our local health department has adopted and stated for the school nurses to use as guidance, as well as our school administrators to use as a tool to exclude children from school if they are considered a presumptive positive. So what that means is any child or adult staff member that comes to school that has fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting or diarrhea. That is a large list there, very extensive. We are not medical practitioners, so we cannot do an assessment to give a diagnosis. What we can do is look at that child's current health history that we have with us, and are any of these part of those medical conditions, and they have to be specifically stated from that healthcare provider. We do not have that documentation. We must send these children home for a minimum of 10 days on isolation. And isolation means that they are considered presumptive positive until they can return a negative PCR COVID test. And there is some confusion about that because Strong Schools does have a couple different languages about using antigen testing. Our local health department has given us furthest guidance on that and said we're not allowed to use antigen testing, which is the rapid test, as a tool to rule out COVID. It may be used in a situation if somebody's symptomatic and they test positive. We can take it as a positive, but we cannot use that to allow the child to come back into school, or staff for that matter. So they have to go out and get a PCR molecular test. And what that means is that can take anywhere from 1 to 3 days, depending on where they go and how busy the laboratories are that certain company is using. Some families choose to go to their primary care provider, which again may delay that because they need an appointment to get in there. We do have resources within our county. StarMed is who we're using a lot of, which is right outside of our local health department, and they are there Monday through Friday from 11 to 7 p.m. We do share that information with our family. It is a drive-through service. Usually they're good about getting results back within 24 hours. With that being said, until we receive that negative PCR test and the nurse clears them, they will not return into the building. Part of contact tracing involves investigating. As nurses, we have to stop and ask the questions. Are these symptoms you're having new or different? Is this part of a current plan that you have in place with us that we are aware of that this is part of your current medical condition? We have to contact the parents. That takes time. Then once we know if somebody is positive per se, we have to figure out who fell under that definition of a close contact and where. That includes within the school setting, after school, sports, on the school bus, any activities or clubs. That takes time. Close contact definition has not changed. Now, Strong Schools and our local health department has given us some leeway and a little extra guidance within the school setting, but the close contact definition is anybody that was within 6 feet for a cumulative time of 15 minutes or more within a 24-hour period of an infected person. An infected person is somebody that tests positive for COVID or is presumptive positive. We give a 3-day period, three business days, where if your child is sent home based on their symptoms, we will give you 3 days to give us back a negative COVID test. If for any reason you don't want to test your child, don't get it back within 3 days, and you don't communicate with your school nurse, we have to presume that you're positive. That is per our local health department guidance. With that, the school nurse does have some leeway. They communicate to the nurse and say, we're still waiting to get in here, or the test is still pending, and we can verify that. We will give you extra days. We do not want the siblings to go home while these tests are pending unless they are positive. So that's the other guidance that our health department has given us. No longer have to exclude siblings unless we know they are positive, unless parent does not want to test that child, then all siblings. That is a whole nother situation, and I'll explain that again in a minute. With that said, the close contact definition does not change. Our Strong Schools and local health department stated that if it's within the school setting, that is during the school day for educational purposes, bus to and from school for educational purpose, after school. If that child, even though they're considered a close contact, whether they're vaccinated or not, were 3 to 6 feet from the person that was infected, and both parties wore their mask properly, over the nose, under the chin, other precautionary measures were maintained, that child does not have to be excluded from school, regardless of vaccination status. They are still a close contact. So as school nurses, we still have to notify those families and say you are a close contact, and we do recommend for you to get your child tested within 3 days. But they do not have to stay out of school while they're pending those test results or during that time. Still let them know that anytime 14 days after exposure, your child may become symptomatic. Please notify us, please keep them home, reach out. That all takes time to explain all of that to everybody. We're doing this to every single student or adult that was within that 6 feet for more than 15 minutes cumulative. When we do identify a positive person or infected person, we go back 48 hours from the day that they're considered contagious. So if they were symptomatic and tested positive, we go back 2 full days from when symptoms started. If they were not symptomatic and tested positive, we go 2 full days from the day they tested positive. As you can imagine, that takes time because we're depending on the adults who are supervising to tell us who was where, what amount of distance they were from each other. This includes the school buses. There is no 6 feet on the school bus. There's 3 seats, or rather 3 people to a seat on many buses. The seat in front is barely 3 feet apart. So we also have to manage that as well. At this time, when we do come to the close contact tracing, when it's within 0 to 3 feet for students, does not matter if they wear a mask or not. The only time that they would not have to be excluded or quarantined if they were considered a close contact exposure, if they are fully vaccinated and asymptomatic. As we know, anybody under the age of 12 is not eligible for the vaccine. So our elementary school, there's nobody there eligible to not be excluded. I recently, just now, added up very quickly what we have done. Currently, we have 10 nurses active in Orange County Schools, and I say active because we hired a new nurse, and that person, unfortunately, has become ill. So we have 10 full-time nurses in Orange County Schools. We have 13 schools. Out of these 3 weeks, today it's the first day of the 4th week, 800 is documented, and I'm stressing the word documented because I have a pile in my bag right now, and so do nurses, emails, phone calls, messages, everything that we have yet to got to. 800 cases have been investigated. 800 students have been excluded from school. Now that might be a positive, it may be a close contact. 800 in 3 weeks. Divide that between 10. Average person takes 1 to 2 hours minimum. And that's if we're only doing one person. And by that I mean we have to contact the teacher, we have to get the seating chart, we have to verify where they were, did they have mask on, no mask, are they vaccinated, are they unvaccinated, were they in school this day, were they in school the 3 days before that, did they ride a bus, do they play sports? If you look on your contact tracing sheet, all of those little boxes we have to check off. Then when we call families, we have to explain that. That takes time. As you can imagine, not everybody's happy to get our phone call because we thought we got through this. There's no more remote option. So that takes time and patience. And we struggle to have parents understand because the rules are different than what are posted in strong schools because we do have to follow our local health department guidelines. Many times I do intervene with that just to take that workload off the nurses, but I'm also covering 3 schools that have no nurses. So as you can imagine, we're all working really, really, really hard. With 10 of us, we're not surviving. We are drowning. We're doing nothing but close contact tracing. And it's just, we can't do it anymore. We need help. Once we've established that they are a close contact and we do put them on quarantine for 10 days, we now have to send messages out to our administrators, teachers, social workers, guidance counselors, and data managers because they need to excuse the absences. Teachers need to know when their students aren't there because the good teachers that we have, when their child's missing from school, they pick up the phone and call the nurse, or they send an email and they say that that child hasn't been here, can you check up on them? So we have to let them know. As you can imagine, that list takes a long time individually. Once we do notify them, we do expect children or their parents to notify the teachers for work. Then we let them go on that area, but it's very hard to explain all of that. We do tell them that once they're out, these absences are excused. They may return on a certain date. If they test negative and they're on quarantine, they still cannot come back. Once you are in quarantine because of a close contact exposure, you must complete the full 10 days of quarantine. Also, our local health department gave us the option to use 10 days, but there is a total of 14 days where you can become infected after an exposure. So we are also explaining that 4 days after that, we want you to self-monitor, and if you do become sick, please stay home and report that. Now, if you are vaccinated and you are considered a close contact exposure and you don't fall within that 3 to 6 feet exception that we have given, we still have to notify you. We still recommend you get tested in 3 to 5 days, but you do not have to miss any school. The thing is, you have to be fully vaccinated. So that's 2 weeks after A one-shot series, or 2 weeks after is two-shot series, a full 14 days. So if you are in the process of getting vaccinated and you haven't reached your 14 full days and it's day 15, we cannot let you come to school. You also have to show us proof of that vaccination, or you cannot come to school. When we talk about the testing, we have been doing clinics throughout the school system to try to get testing done, vaccination clinics. We just had one with Orange High School this Saturday. Again, our nurses are working these clinics as well. We're working into the hours of the night, waking up to the morning. We're not getting any weekends off. We're not getting any rest. It's very, very time consuming, and we are asking for help. I think I've explained everything up there. Are there any questions?
Well, I just want to say first, thank you doesn't begin to cover the service to our students and to our district, but still, thank you so much to you and to all of the nurses. Other board members, questions? Ms. Smiley?
Question, the 800 that investigated or excluded from school, does that students who are just symptomatic, and does that include that group as well, or is that only positive cases? And
That includes all of them.
do you happen to know how many students and staff have been?
Without being positive for close contact or presumptive positive, because remember, you can quarantine. Quarantine is if you've had an exposure to a positive person. Isolation is if you are in fact positive by confirmed lab tests or a diagnosis, or you are a presumptive positive and haven't been tested yet. So do you mean the quarantine group?
I think I just mean the quarantine group, because I think the other group, the positive and presumed positive, are who would be on our dashboard.
No, ma'am. Only the positive cases
Okay.
that have affected us within the school district, and Ms. Stowe can talk about that more. Go on our dashboard.
Okay, so the cases that are presumed positive, sort of positive, those are.
No, ma'am, because we do give them a 3-day period to get tested, and if they come back negative, then we allow them to come back to school.
Can I just ask all board members to pull their mics up a little
Sure. Sorry
closer,
about
just
that.
for the
Yep.
folks that aren't here? I think that will help them hear us. Ms. Doyle, then Ms. Hauser?
Thank you, Ms. Compton. I just had a question about the requirement to contact trace all positives and then all presumed positives if they don't have a negative test within days, a negative PCR test. And then is that like a district level decision of its contact traced, or is it a Orange County Health Department?
It is an Orange County Health Department, yes. And I thank you for bringing that back up, because I did forget to mention household member exposure, which tacks on another 10 days. So if there's a positive household member, not only does that child have to miss school for their quarantine period, but they are also out during that positive person's isolation period. The reason for that is it is very, very hard to prevent any illness within a home. So therefore, once you are positive, you cannot leave the home and officially start the countdown on your 10 days of quarantine until that person's 10-day of isolation period ends. And that person that is on isolation is considered contagious throughout that 10-day period. So they can reinfect anybody, or infect rather, anybody in their home within that 10-day time frame.
But if siblings were fully vaccinated, they would still be excluded, right? Unless they became symptomatic themselves?
So if you're fully vaccinated, regardless of where the close contact exposure comes from, and you are asymptomatic, you do not have to quarantine.
So first of all, you're having an impact because I'm getting texts about people that want to know how they can help. So something to consider, and maybe families can going on at home. But that's really my other question, and as we heard from one parent whose child has allergies, and so they triggered the runny nose criteria, and now they got quarantined. Is there a way for families to let you know about, if you will, existing conditions or propensities of the child so that if the child shows the symptom, you might realize it might not be COVID.
Yes, ma'am. So all of that has to be documented through their medical provider. What we know now with the Delta variant, not only that it spreads to a lot more than the original COVID variant, it's that it is presenting very mild, with mild symptoms, which is why the Strong Schools and our local health department adopted to add these extra symptoms. The congestion, the runny nose, the headache. It used to say severe headache with, doesn't anymore. It changed on August 18th. Runny nose, congestion was not in there, but it changed on August 18th because what they have found throughout our state and throughout the world is that the Delta variant is presenting itself with mild symptoms. So just to say that my kid has allergies, we can't go by that. It has to be something documented by a medical provider, and it has to be specific to that actual symptom.
They provide that kind of documentation.
Yes, ma'am. What we do then, we look at whatever goes outside of those parameters. What has changed? Is it versus where it would be mild? Is it severe now? That's what the nurse can do.
Ms. Smiley?
This is not so much a question, just it's more of a suggestion, which is, what I'm hearing is that nurses are often on the receiving end of a lot of frustration from this, which I am sure adds to the load as well. I do think, I've spoken to a nurse this week because of symptoms in my family. I think that there's opportunity for us to do more proactive messaging. I know we're doing a bunch of proactive messaging already, so that maybe people aren't, like, talking to the nurse isn't the first time that they're hearing some of it. So I think that we could get ahead of this. Like, what I'm hearing from the after 3 days you're presumed positive is, like, if your kid has symptoms, go to the health department because they have a fast turnaround the very first day you're able to, and get a PCR test so that you can have that back as quickly as possible. And then if you do not have COVID, you can go back to school once you're symptom free. So that there's some, like, can we do some proactive messaging? Are there pieces of the conversation that, like, could record a video one time explaining some part of the process so that, the nurse could speak to them and say, and please watch this video. We could text them the video. I'm just wondering if there's some other ways to use messaging to cut down on the workload, and also just have nurses be sort of like, so that families aren't as surprised about some of the things that they're being.
Yes, ma'am.
Any other questions? Thank you, Ms. Compton.
I just wanted to mention, while Sylvia's here, you've heard about the hard work and about the effort that's being put forth. As far as supporting our school nurses, we're continuing to put forth the best plan that we can to provide them support. This evening, you have an additional agenda item where we'll talk about staffing, including additional staffing to help us with contact tracing. So individuals that may be interested in a job posting that's coming very soon about contact tracing, there may be an opportunity there as well. And the second thing I would say to the public, how can they help? If your child has symptoms and you have been advised to not send your child to school because they're quarantining, isolation, any of the things Sylvia said, please do not send them to school, because all of the workload that you've heard about increases again, because now that child, if they're back on a campus, it starts the cycle over again with all the other students now that are close contacts that we may be having to go through this process with. So the other thing I would say is, we know it's difficult, but please, if you've been advised, keep your child at home.
The job openings, are they full-time or part-time or both?
There should be a combination of both. We are certainly looking at both options for individuals coming on board, whether that's a person who can work an 8-hour day. Most of our job description will be like 12 to 5 p.m. on site, take time off, and then complete the remaining hours at home. So it doesn't all the 8 hours doesn't have to be on site. It does during the 12 to 5, but we also can do that work remotely as well for individuals that can help out. What we find is most of our work is happening in the evening when we can get a hold of parents.
I just have one thing to add that's not on that agenda. I talked to you at length about contact tracing, quarantine, isolation. Do not forget other job school that has not stopped. So it is compiled on top. We have a lot that we're required to do to be taken up because of contact tracing. Thank you.
Next, we have Nick Mincy, our Director of Capital and Facilities, going to talk about tents and outdoor learning environments.
Welcome, Mr. Mincy.
Thank you. Good evening, Chair, Superintendent, and board members, and everyone that's here. This is an opportunity to talk a little bit about what we're trying to do to get some outside areas developed for our students. Mr. Obley, myself, and some other staff members from the Maintenance and Facilities Department has been working with Orange County Board of Inspections. We've met with them, the fire marshal, and we have developed a very strong plan to move forward to create some outdoor space for students. I'll be very honest, when I first started the process, I thought it was just going to be some nice tents outside. And as the process began to develop, we realized it was a little more complex. The board, the inspections department has been very helpful, have given us some really good guidelines, and we are moving forward. We have walked all the campuses. We have determined locations that meet all of the requirements that the inspections department is looking for. And we have resourced vendors that we have those meet those characteristics that we need for the tents for the outside areas. The tents that we currently are looking at are 20 by 60, which is about 1,200 square feet. And then we would also need some additional sizes that are more like 30 by 30, around 900 square feet. And we're looking at all the options on how many we can place on a campus and meet the requirements the inspections department is going to hold us to. There's some very strict things. We can't be any closer than 12 feet to the building. We do have to provide ADA compliance at those structures so that all students can have the opportunity to use them and be outside and have that opportunity. So there's been a lot of parameters, and we are in a very good place. We've located vendors who have product. The time frame currently is a couple of weeks, but probably more in the 5 to 6 week range. We are not the only school district in the United States trying to purchase tents. And obviously this is the event time of the year, so many private businesses are also providing tents for weddings and outdoor venues, which are at an all-time high. So, so we are working diligently on it. We should have some good results very soon. So, questions on tents? They would be just very somewhat, just for a simple description, they're going to look just like what you'd see maybe at a wedding event or a family event outside. They would be a pole structure. They would be secured to the ground. The county allows us to leave them up for basically 180 days with some very strict guidelines. Once we hit that 180 days, we'll do a re-inspection with the county, make sure that everything is safe and secure for our property, and then we'll start again. So, good shape there.
This is good to hear. Thank you so much. Ms. Miley?
As a quick, will they stand up to like winter weather if we should get some snow and things like that?
The guidance so far from the vendors that we've been talking to is you're good down to approximately 40 degrees as long as it's not for an extended period of time. So basically what they're saying is that if you're 40 degrees and at night you're down in the 20s, should not leave that structure up for an extended period of time. If you're 40 at night and you're back up in the 50s and the 60s during the day, you can leave that structure up as long as you need. So it's that 40-degree breaking point that we start to look at some parameters that we'll have to address. And we do intend to put these up and leave them up as long as we possibly can, weather permitting, obviously.
Comments or questions? Mr. Atherton?
So not so much a comment or a question on the to tents, but I just wanted to take a moment to acknowledge and thank the maintenance for helping out with all the transportation and traffic and everybody that was pulled in. It was very noticeable how it helped while we got through the first couple of weeks. And I just wanted to say thank y'all for stepping in and helping us out as well.
Yes, sir. Thank you for that. Any other questions on that?
I was just curious, Mr. Mincy, what ADA requirements do the tents have? Like, is there like a surface ground requirement for ADA compliance or?
So what we have done is we've looked at all the campuses and determined where we have a sidewalk access that is ADA compliant to the rest of the campus. Orange High School was one of the most difficult. The terrain there is up and down, and we've determined we can use elevators to get to a ground floor to get out to a safe space so that you can literally take a chair directly underneath tents.
Thank you.
And we have to offset them to keep that 12-foot rule too. So it was a lot harder than I thought.
I can imagine, especially at Orange High.
Thank you. Oh, Dr. Moore, did you have a question?
And I know that I had a note about tables. Can I address that real quickly for picnic tables? So the maintenance department and some outside vendors, of course, sourced a tremendous amount of wood picnic tables. I know that you've all seen them on the campuses, and they have been in use now for a while. We also have sourced additional tables. We have 112 tables for outdoor use. We are assembling them as quickly as possible, and the distribution of those has already begun. I think well over half of them are already on campuses, and we'll have that done this week. So.
Thank you so much. No, ma'am. You may email questions to the board.
All right, so we have a few more items here. Next, I'm going to cover COVID testing for students and staff as previously approved by the board, testing for athletes and those participating in extracurricular activities that are truly extracurricular, that do not have a tie to the curriculum or to the school day. The board approved us moving forward with the COVID testing process in order for students to participate. We're still working with our state vendor to set up those testing with the testing protocol. We are starting the notification processes this week that will allow or notify the families and allow them that opportunity to send us the information that's required for continued participation under the testing protocol. We did have an in-depth discussion with, since our last meeting with the Orange County Health Department. They are allowing us to utilize the rapid antigen test for our second test. We did talk about having tests twice per week. So if the vendor's not able to do twice per week, once will be PCR testing, and then the second test will be a rapid antigen testing. The ABC Science Collaborative has provided our first shipment of rapid antigen tests. We picked those up Friday. We have approximately 1,050 units that are ready to be deployed just as soon as individuals are trained, and we're ready to start the process after the notifications. And then again, just as a reminder, what the board approved was any student athlete or student involved in extracurricular activity does not have parental permission to complete the required COVID test will be ineligible to participate, effective immediately once the testing program commences. And again, those are for our individuals that are eligible and are participating. We did talk about students that, may be certainly not eligible to test because there may be a reason that that student has maybe a bleeding disorder or some other reason. And so we would go through the medical review process if there is a reason a student medically cannot test. The second part of this was testing other students within the school environment and looking and working with our vendor. And we have a couple options, and I would have additional information, but I'm just not able to present multiply with the screens here tonight. But we have two options. One of those is a polled testing process. So we take everyone that's in this room tonight. Everyone does a rapid antigen test. We put it in one jar. Everybody tests, swabs, put it in a jar. And then we run that test, and we get a result back. And that result says one's positive for COVID or someone's positive for COVID. And so it's a quick way to do a surveillance to know if there's a individual or individuals within the environment that currently have COVID that are asymptomatic may not know that. It's rapid, it's easy to deploy, quickly can be done. We have results in 15 minutes. When we talk about PCR testing, or we're talking about individual antigen testing, we're talking about individuals each having a test. Part of that process then requires a test number, an ID that's associated with that individual. You have to have test security and transfer of that test material. You have to secure it for that individual, get that to the testing site. We get the PCR test back in 24 hours. Then there's an individual report that's given to that individual or sent to that individual. Most of them are online. And they receive those results electronically or by other means. Sometimes it's a phone call. And so they would have their individual results. With the antigen testing, again, we can do it individually. We still need to track and record those tests per person, but we can still get the results in 15 minutes. So when we talk about the general K-12 environment, the school population, that would be an opt-in process is what we recommend, that parents have the option to opt in. And based on the information and strong tools, CDC and the ABC Science Collaborative, it is not recommended that we test vaccinated individuals. Now, for staff members, we did say initially, we felt like all staff members, because it's required for initial employment, that all staff members should receive initial COVID test. And we did hold a testing clinic a couple weeks ago and had 150 some individuals went through that are staff members for that initial testing. We'll catch back up once we have our vendor on site. But for the ongoing testing, surveillance testing for staff members, we're not recommending we test vaccinated individuals. For students, we're not recommending we test vaccinated students. However, if a parent opts into the testing program and the test provider allows a vaccinated individual to take the test, then certainly we would have that as part of our surveillance program. But surveillance is just that, it's surveillance. We're asymptomatic, we're looking to see the prevalence, the number of cases, and do we have an issue that we don't know we have an issue? It is not diagnostic. If someone has symptoms, that is not the testing we would be performing. We're not trying to rule out whether someone has COVID or doesn't have COVID. It's monitoring. If an individual suspects they had COVID or an exposure for COVID, local health providers and the community health agencies are the place where they would go to get the free COVID testing completed. Questions or comments about the staff or the students testing? And I did forget to mention just the number here, and we'll talk specifically about athletics in a minute. We have about 600 plus athletes right now in fall sports that are signed up for our middle schools and our high schools. So when we talk about specifically athletics and the percentages of individuals that are testing, we're going to need somewhere approximately 200 to 300 tests twice per week for the unvaccinated students. So that gives you an idea of about approximately how many tests we would be performing. Part of our concern about launching and rolling out a testing protocol or process at this point, if we test, we immediately will trigger contact tracing protocol. You just heard the dilemma we're in with the amount of contact tracing that's taking place with just the operation of the school day. We have no capacity to take on 200 to 300, whether it's students or staff, additional testing this week or next week until we have the protocol in place, the contact tracers, and a process that allows us to seamlessly make sure that we're testing individuals appropriately and as directed or expected from the board. So I wanted you to know there is a purposeful pause there, and that's because of our capacity and where we are getting our contact tracing and making sure we have the right supports in place. Because we know what we've learned is individuals may have COVID-19 and they're asymptomatic and they don't know it. So once we start the testing process, that will trigger that contact tracing. I'll pause there.
Mr. Obley, do you anticipate that with the request for staffing that we'll be voting on in a little while, that that will create the capacity to implement the testing program?
We do feel it will help us get to where we want to be. Now, right now, our initial concern is the amount of contacts that are being made and just to catch up our school nurses currently with school operations. But we do plan on assigning an individual or individuals who can help us with just athletics and work on the athletic contact tracing. So we do expect that to assist us and help us. We know what we've asked for this evening is 6 additional contact tracers. If we can find more, we'll come back and we'll certainly ask for more and utilize all of our funding that's available for this purpose. We also know we have 2 individuals that we're in contact with to start tomorrow. I'm not sure if Sylvia's still here, if we still have 2 or not, but we're ready to, as soon as we have the individuals that are trained and ready to perform the duties, we will launch and we will assist. But right now, our first priority should be supporting our school nurses with the cases they are dealing with, and then have that plan ready, and then communicate that to our families, and then begin the process for the testing.
Okay, I'm glad to hear that you'll continue to look at expanding to make sure that we can implement a testing program as quickly as we can. So that's helpful. Thank you. Ms. Doyle?
Thank you, Mr. Abeles. So just to make sure I understand, so the vendor that provides the testing, do they provide also the people to do the test themselves, but then we'll be providing our contact tracing, and that's one of the tensions?
That's correct. I'll ask Sylvia to come up as well to talk more about the vendor and the specifics with the vendor. With one exception, the test that we received through the ABC Science Collaborative, that's a separate process. We would be the ones training, administering, and completing all tests that we receive through them. The vendor, and that was one of the benefits of going with the state vendor, is the vendor provides the personnel. Now, we will have some personnel needed. Obviously, we're going to need school support, logistics support, setup, and questions and things that take for the testing process. But the vendor will be providing the personnel in order to complete the test. And then they also would be responsible for reporting any of the positive cases, is my understanding as well. That would
That's the PCR, the state grant that we got.
That's
for
correct.
just the PCR. Thank
Yes.
you.
Bonnie had a.
Oh, Ms. Hauser?
Yeah, just the surveillance testing. Is that, that doesn't trigger, that's not diagnostic for an individual, right? That just tells us in general how we look, so it won't trigger contact tracing or?
It certainly may, and it could. It depends on how we're doing the surveillance testing. If we're surveilling this room and there's a positive result, then we would have to run through the process of everybody in here we know was here, and if are there any that meet the definition for close contacts, et cetera. I don't know that we've had the detailed description on a pool testing of how that might work. So I'll need to get back to you some information on how that might look in a pool testing scenario. Individual testing scenario, yes. If an individual tests, then the protocols would be required to be followed as far as a positive result.
So priority-wise, the athletes first, and then there's the broader surveillance testing.
That's correct. Our process was initial testing with staff members and athletic students or extracurricular as a kind of the first initial phase. Then the second phase would be what the board asked us to explore with the vendor, which was any additional testing that we could do school-wide. And that's what we're reporting here tonight on the options and the processes we have so we can work with the vendor to bring that.
Ms. Smiley?
So we had earlier in the spring gotten some guidance that the ABC Science Collaborative was not recommending antigen testing. And so I just want to make sure that I'm understanding. So we're receiving the antigen tests from them, and they are now supportive of us using them?
Yes, so a couple things has changed since early spring. The variant of the virus, and this is, again, me summarizing information that was given to me. I just want to be clear that I am not the expert on this topic. The virus that we were dealing with in the spring, the concentration and the methodology and how the tests were being processed quickly to get those to market is different than what we have today, the tests that are available. The amount of viral load from the Delta variant is much higher and more concentrated as well. And so the antigen testing, and there's multiple ones out there, but the one they recommended is much better at picking up and decreasing the amount of false positives and the issues that the antigen testing had earlier. So they talked us through kind of the process and the test and how the test, for the purposes that we're using them for, would be an excellent option for us. Certainly, in the other setting, it might not be appropriate. Say, screening someone who's about to go in for major surgery, that's probably not really a test that would be preferred over a PCR test. But for our purposes, for surveillance screening, that test was recommended.
And it's great to hear that it is now better at preventing false positives, because I think that was part of the concern earlier, what all of that triggers. So thank you.
We don't have anything that's 100%, but it certainly is much better than the antigen test, which was some of the concerns from the spring. I can get you the clinical data on those tests as well.
This is all opt-in, right? So do we have any sense about how many people are staff has to be tested once, but then it's opt-in for staff and students? So if you don't want to be tested, you don't have to.
So for staff members who are vaccinated, we wouldn't recommend they be tested. I mean, certainly if they wanted to opt in, they could, but we're not going to recommend that we put the resources towards testing vaccinated individuals. That's not the recommendations from CDC or the toolkit. For students, it would be an opt-in with the exception of what you've already approved, which is those involved in athletics and extracurricular activities is required for.
Other questions, comments?
So next, just to give the order of business here, we'll have Melanie Stowe give a communications update, followed by Joyce Hatcher with vaccination status. And I'll be back to finish up with our act.
Thank you.
Madam Chair, Vice Chair, members of the board, and again, I'm Melanie Stowe, Chief Communications Officer. And if you don't mind, next slide, so I can go over a few communication updates. While that's switching, so real quickly, over there, thank you. Thank you very much. So first, we do send, anytime there's a positive report of a COVID case with an employee or a student, we do notify all families and all staff that are located on that site. And we do that via a letter. And we have made an update. We have added definitions of close contact and what that is as stated by the North Carolina Department of Health and Human Services and the Orange County Health Department. We've also added an infographic that will accompany those letters starting tomorrow. This will be in English and Spanish, and there's a graphic that's on this slide to represent that. Again, it's just some more details, And as our lead nurse, Ms. Compton, mentioned earlier, we want to help educate families, but in the end, if there is ever any doubt, we do want them to reach out to their school nurse or their medical provider or the health department. And for that reason, there are a lot of scenarios. If you're this, if you're vaccinated, if you're not, what are the days you count back? There's so many scenarios that we are really trying to keep it very simple and broad. And so these basics in general apply to everyone. And then if you have a vaccine, then that's when you really do need to work with your medical provider or the school nurse to determine how that does or doesn't affect you with regards to quarantine or isolation. We also will be holding a vaccine Q&A this Wednesday at 4:30 virtually for our staff. The Orange County Health Department will be providing that, and they will spend the first 15 minutes talking about kind of the myths and the FAQ of everything that they've received since the vaccines have been out, go through that, and then allow staff to ask questions of the medical professionals. And we will record that in the event an employee is not available to participate live, and they would have access to that the following day. And I know we've also talked several times about text messaging, because I'm going to again go back to what Ms. Compton was saying. When nurses are having to notify 20, 30, 40 plus families on an evening, we want to make sure we can communicate effectively with our families. So we did enable last winter the ability to text message. We did pilot that with Central Elementary School. We are still piloting that with schools, but we have a process in place for the next 30 days that we will be working with data managers and a few other select staff to ensure that we have that information accurate. As I mentioned previously, we can't just say, well, I have your cell phone, I'm going to now text you. There are federal requirements that make us have to let you opt in. We can't opt you in. So we will be going through that diligently because we need to be able to communicate, and this will not be overused, let me assure you. We will be text messaging significant events like closing for weather, and again, if there's a need to isolate or quarantine. We want to be able to capture people immediately, but again, not overuse that. So there'll be more coming with regards to our text messaging. And as always, we are always open to how we can better communicate and be efficient and effective with our families, but also not over communicate that it becomes noisy and we lose sight of the things that really matter. Any questions?
Mr. Atherton?
So just one item. I know that beyond the text messaging of our families, that the general community would like us to have a way to communicate with them that aren't family members so they could get updates like the meetings and the agendas. And, you know, we talked about it in the community engagement of beyond power schools to do that. Do you have an idea of how that's coming or if something's coming up?
Yes, and I'll follow up. I'm pretty sure that I did provide an update. It's been a while, but we did find the system that was referenced that the government uses, and that being the county government. It also comes with a price tag attached that we are not eligible for being a school system. So we're still looking into that, but that system platform wasn't available. We're also looking at your platform via Assembly, and if there are any means and ways to better use that to inform folks, because I know it's done elsewhere. It's just a matter of us determining how to do that and apply that.
Yeah.
Go ahead.
No, sorry, please.
Well, and I also just wanted to mention, and I didn't share this, and this wasn't specific to board meetings, but we do on our website, and we have had this since we opened, have a COVID dashboard so that anyone in the community, it's updated every Friday at 6 p.m. And if you want to see the number of cases at school by student or staff, that is on our front page of our website, because we do want to be very transparent in what's going on with regards to COVID cases in our schools, because that is a community issue, not a school issue.
Yeah, the only thing I was going to say is, I mean, even if we set up a listserv, I think would be step one just to get information out. And I get the subscription and people can manage it, but a list server we could do as well, which would get us to that first point for people to be notified.
And I'll provide an update. Thank you.
Thank you.
Ms. Hauser and then Ms. Smiley.
So this is a little overwhelming because there's so much communication. So there's the COVID and then there's everything else. So when you talked about text messaging, is it everything or we're just talking about COVID right now?
So right now, our goal in the next 30 days is to make sure that our contacts are correct, to make sure we have accurate email accounts, we have accurate phone numbers, and then also on top of that, if your phone number is a cell phone and you would like to receive district notifications, specifically inclement weather, closure, opening late, or anything specific with regards to COVID and your child, then that you would opt into that. Now, moving forward, there is the ability for schools to use texting at a different level, but right now we want to address just our primary basic needs. And then I've also spoken, and this is not just my decision, but spoken with folks in the data management side and also the technology side, that would be a phase 2 rollout because we need a process. We don't want you to have 10 text messages about the 10 meetings and then you miss or disregard a message that's what we would consider very important.
That last point is very thoughtful, and thank you for all of the thinking you're doing about how to best communicate with our families. I just wanted to, and I had sent this in email as well, but I'm not sure if the close contact definition in the infographic has been modified to address the 3 to 6 foot distance and sort of the other criteria that Ms. Compton was talking about earlier, but earlier it had spoken only to you're a close contact if you're within 3 feet with or without a mask. And I would just really like to see us use the fuller definition that includes or 3 to 6 feet if you are not consistently masked, because in situations where kids are inside eating and taking off their masks in inclement weather, as much as we're trying to be outside, that's going to create additional close contacts, and it can cause confusion for families about why they were identified if we don't say that it's actually the 6 feet if you're not, consistently masked. So I just wanted to reiterate. I know that there's plenty in your inbox, and I just wanted to reiterate that suggestion.
And we appreciate that. And we do discuss and have discussed that because we're always looking to do better. And I do know that Ms. Compton and the other nurses, when they communicate with families, if there is an exception, then those things are shared at that time. And so our debate now is when we put exceptions in the letter, we don't want to confuse people, but we continue to look at this all the time because we can always do better and we always seek to do better.
Thank you so much, Ms. Stowe. Any other questions, comments from the board? Okay. Thank you.
Thank you very much.
Compton.
Sorry, but I'm going to interject on that last comment. There will be an update with Strong Schools tomorrow that may have on close contacts, I was told. So just be on the lookout, and I want everybody aware this is constantly changing. So as soon as it changes, we will let you know.
That's really helpful. Thank you for jumping in here.
Okay, Ms. Hatcher is going to speak next to vaccination status. Hatcher is the Chief of Human Capital and Organizational Development.
Good evening, Madam Chair, Vice Chair, Dr. Felder, and members of the board. Can we please move forward to the next slide? As they're moving, I am here to provide an update on the staff vaccination status update. The data you see here before you is as of today. We have, okay, go back one more, move forward, please. As of today, we have 911 OCS staff members who have self-reported that they are vaccinated. This data also includes individuals who have at least one shot or received one vaccination. Also, too, if you look here at this data is by site. You have your school locations first, and then your other locations outside of schools. Want to give a little overview. We went over and provided some information on last board meeting on August the 23rd as to how we got here. Basically on August the 23rd, HC Human Capital Department requested that all vaccinated staff members provide documented vaccination status data. That is a copy of their vaccination status card. Staff members had until September the 10th to provide us with this information. We received this information either through a Google Doc that was shared with all staff members. Staff members who could not access the Google Doc, they were able to provide us hard copies of their vaccination data by either faxing that information to HCD office or either bringing that information to our offices. As of September the 2nd, we noted that we did not have all the responses that we needed to provide the board with a better update. So on September the 3rd, we created another kind of like an outreach vaccination status project update where we wanted to expand our efforts to make sure that we had more data. So as of September the 2nd, and I'm giving these numbers because the numbers that you see now have gone up as opposed to what we had on September the 2nd. On September 2nd, we only had 712 responses, and that was 48%. So on September 3rd, we implemented a vaccination project where we asked cabinet members, principals, assistant principals, directors, supervisors to have a conversation with their staff around that vaccination data. There was a script provided to make certain that we were consistent with our efforts. That script was vetted with the board attorney to make sure also that we were not asking information that we could not ask. And those questions were, are you vaccinated? Do you plan to be vaccinated? Or refuse status. So as of now, this is where we are, but we also wanted to note that we are providing our staff, and this has been indicated in the previous presentations this evening, that we are providing our staff with information and locations as to where they can go to continue to make certain that they are being screened and being screened, being vaccinated. Also, too, we are asking, our deadline was September the 10th, but if we have staff members who want to continue to provide us with this data, we will accept this data. This concludes my report, and are there any questions?
Ms. Hatcher, Ms. Doyle?
Thank you, Ms. Hatcher. I just want to give a shout out to Partnership Academy for having 100% vaccination. First site to do that.
Way to go, Partnership.
Also, too, might I add, I just want to give it, as we're giving shout outs, I want to thank the entire Orange County staff for participating. We asked for a lot of information. We've gone to them several times. Also want to thank the Human Capital Department. One of the things we did do to ensure this data was we did provide Human Capital Department staff at each school location so that staff members would have an opportunity to provide us with this information.
Other board members? Ms. Sayre?
I may have missed this. So what percentage of staff have we not yet heard from that they are vaccinated?
I would have to check on that and give you that based on the way we asked this data. We asked the data of staff members who were vaccinated. So what you see here is data from staff members who have been vaccinated. I do not have the data at this time of staff members who have not been vaccinated. It's based on the way that we structured and we conducted the survey when we started.
Thank you, Ms. Hatcher. Anybody else?
Thank you.
Thank you. Okay, so next up will be Mr. Aberley, and Mr. Aberley is going to provide the board with an update and recommendations with regards to athletics. Just want to state that safety in Orange County schools remains the top priority. It is our top priority. At the August 23rd board meeting, staff were asked to bring an update on COVID-19 in athletics, and we're bringing that information to you tonight. Please know that the recommendations presented tonight are informed by the North Carolina Department of Health and Human Services. They are informed by the ABC Science Collaborative. They are informed by the Orange County Health Department. These are the experts on COVID-19. So as you receive the information tonight, please know that the goal has not changed. We want to be preventative. We want to mitigate transmission of this highly transmissible virus in our schools and in our community. This is a public health matter. It is important to note that in a communication from the Orange County Health Department that we received today, we were informed that per the CDC, the transmission rate in Orange County is currently high. The transmission rate is high, and this transmission rate is determined by total number of new cases per 100,000 persons in the past 7 days and percent positive during the last 7 days. Unfortunately, a representative from the Orange County Health Department tonight. So with that, I turn things over to Mr. Aberle.
Thank you, Dr. Felder. Just wanted to point out, we have quite a few pieces of information in your abstract for you this evening. Some of the background information is source documents through the North Carolina Department of Health and Human Services, their August 6, 2021 update for participants of youth and amateur sports, the North Carolina Department of Health and Human Services Strong Schools Toolkit. Again, as Dr. Felder said, we've reviewed information with the Orange County Health Department and the ABC Science Collaborative. To our student athletes, they strive to provide excellence in all they do on and off the field. We recognize the hard work, the dedication, and the amount of hours and time that they put forward in doing athletics for their respective schools, not only representing themselves, their school, but the school district. And we are very proud of our student athletes. It's not easy being a student athlete. I was a student athlete in high school. We know the challenges that present themselves when you're at games late. You're getting up early. You're trying to juggle your schoolwork, your calendar, work schedules, household items that need to be addressed. It's not easy. But we also know that we have a challenge before us called COVID-19. And it's important that we bring you regular updates regarding not only the health and safety recommendations for the school district, and you've heard the past hour or more, those updates that we're providing with all the initiatives and work that's going on, but also to provide you regular updates regarding our athletic programs. I do want to just reference one thing before I get into specific recommendations that you'll have on your screen here, is we are following the North Carolina Department of Health and Human Services Strong Schools Toolkit. As you heard, that may be updated tomorrow, so I'll give you the information as of this evening. We have high transmission in our community. That puts us in the red zone. High-risk sports and activities. The recommendation is cancel or hold high-risk sports and extracurricular activities virtually to protect in-person learning. I'll say that again. Cancel or hold high-risk sports and extracurricular activities virtually to protect in-person learning, unless all participants are fully vaccinated. That is the recommendation from the North Carolina Department of Health and Human Services and the toolkit based on CDC screening recommendations for K-12 schools by level of community transmission. That's where we get the recommendations from. We bring you the recommendations that are made by individuals who are monitoring, who understand impacts, and what we try to do is not ever come before you and say, we have an outbreak, we have clusters, we have things that are out of control, we need to shut things down. We have to monitor, we have to be proactive, we have to make sure we're ready to provide the health and safety impacts we need tomorrow, next week, the week after, and not wait until we're in a crisis. Our community has high transmission. Our community's reporting still high transmission today. Some of the concerns is we have not seen the impacts of Labor Day weekend yet. As individuals and the number of cases have gone up on our dashboard this past week, even today, our nurses opened up this morning with cases waiting on them from the past weekend for individuals who started having symptoms, who went to get tested last week. We know the numbers don't necessarily change in one day. There is an average that's looked at over the last 7 days, but we know those can tick up and tick down, and that may take 7 or 14 days for that to happen. Cancel or hold high-risk activities, sports and extracurricular activities virtually to protect in-person learning. We want to protect our in-person learning. That's our goal. We want to make sure that our students that are participating in athletics are healthy and they're safe. That's our goal. We want to make sure anyone participating as a coach, any fan that's coming into an event, a parent, a grandparent, a citizen that may be attending one of our events is safe. That's our goal. We have to look at the programs, the requirements, and the impacts that it will have if we're not operating safely. And so our goal is to bring you recommendations. Certainly the board has an opportunity to question those recommendations, to provide feedback and guidance on the recommendations, and help us implement and give us guidance on the recommendations that we should implement. So what we have before you this evening is a host of recommendations, and again, based on not only the guidance, but this very board asked us to start looking at things more individually, rather than grouping all athletics in a basket. Could we start to look at programs by specific sports? That is aligned to the recommendations. We did not decide which sports or sports teams on this list were high risk, medium risk, or low risk. That was provided within the guidance. And so when we look at where we are with our current state and our recommendations, and we know these are tough decisions. We know what we have before you is not easy. It's not easy for you, it's not easy for staff, and it's certainly not easy for our student athletes. But we are recommending that the following high-risk sport programs be closed immediately following guidance from North Carolina Department of Health and Human Services, and the Orange County Health Department with high community transmission rates and high risk for transmission due to close proximity of athletes on and off the field. Closure of these sports programs would include those actively participating in season and those programs offering off-season practices or workouts. That's why we went ahead and listed the high risk, medium risk, and low risk sports, because even though they may not be in season right now based on North Carolina High School Athletic Association in season for fall, winter, or spring sports, those off-season workouts are beginning and those students are already gathering with their teams and those workouts are commencing. Football has a high risk for transmission, along with basketball, wrestling, and competitive cheerleading. I'm not aware that we have competitive cheerleading here, but I'm sure I will be corrected if we do. But if we do have that, that is considered high risk because of the amount of time students are with each other and performing moves and routines. We're recommending that we begin an immediate closure for these programs starting tomorrow, September 14th through September 30th, that 2-week period. That would allow us to reassess, allow us to implement and add additional guidelines to be followed, such as for all of our events, all fans be masked both indoors and outdoors. Physical distance required by non-household members. Attendance limited to parents or guardians or others that the athlete may choose up to 2. I know sometimes loved ones or individuals may not necessarily fall in the category of a parent or guardian. We may have mentors that an athlete would like to come out to a game or, have an aunt or an uncle who happens to be in town. Maybe they want those two individuals to come out for a game. We understand there are other individuals, and so we would modify this to allow, that athlete to just designate the two individuals that would be coming. And then no selling of food items or concessions. And part of the issue with the food items or concessions, especially for indoor venues, but outdoor venues, once you have a mask mandate, is we have the premise of the active eating or drinking, that I have to have a mask on unless I'm actively eating or drinking. It does not mean I hold my water for 6 hours and I take a sip every 3 minutes and leave my mask off the entire time because I'm consuming. There should be a brief, it should be intermittent, and it should be a process that quickly allows individuals to resume wearing of the mask. We also know that the more we allow individuals to remove masks, the challenges we're facing with students and just the 15 minutes of keeping a mask off. If you have 300 to 600, 800 people at a game, and individuals are taking masks off at will for eating and drinking, it really defeats having a mask policy. And so those really would go hand in hand. Certainly you can advise us otherwise, but if you have an outdoor mask mandate, then we should limit the ability of individuals to remove those masks. For these athletes in the high-risk sports, and that's the other thing we've done, is try to make it clear for coaches, athletes, or individuals involved in the sports, what are the individual requirements when it comes to masking. These athletes would be required to have a mask on off the field of play, regardless of vaccination status, because what we're recommending is all of these student athletes in these high-risk programs be fully vaccinated in order to continue participation. We know that's obviously a challenge, as you heard feedback from last month when we discussed this, but for high-risk sports, we have to put the safest protocol in place that we can. What we're seeing, and I'll talk about numbers, is vaccinations work. Vaccinations are working to keep individuals from becoming more severe with symptoms from the disease and helping individuals not rely so much on emergency medical treatment and hospitalization. Those are facts. So our students who are eligible for vaccinations, in the guidance from the CDC and the Strong Stools Toolkit, as an educational agency, we should be promoting and are to be promoting vaccinations. We are holding vaccination clinics. We held 2 last month. Well, I guess it was one in August, one was September 2nd. We held another event this past Saturday. We will have another event October 2nd. We will hold other events in November. Whatever we can do to help our individuals, whether they're employees or they're athletes or members of the community, find a vaccination site, we'll do it. We will help them. We will find vaccination sites. We know individuals can go get a vaccination at any of the agencies or healthcare locations across the state. But we certainly want to help and assist with any vaccination requirements if that is what the board approves. Again, the 2-week period allows us to get protocol and procedures in place, continue our vaccination status tracking for our current athletes who have reported. We have some I couldn't include in the statistics because they self-reported they were vaccinated, but we haven't seen the documentation yet. And so we need to notify them as well that we're still waiting on that vaccination status. And then also give us time to make sure we're very clear about the expectations both on and off the field of play, and also protocol and processes for fans or individuals that may be attending venues. I'm going to go through, if it's okay, all three, and then I'll pause and take questions, if that's okay. If you'll scroll down for me, the next is what we're calling the limited sports program. And again, because there's limited contact for individuals, it doesn't mean there's not risk. I mean, all of these categories have risk. But these sports and activities may continue to operate on a limited basis with modifications for both the participants and the spectators in order to reduce the risk for COVID-19 transmission on and off the campus. All students participating in these programs, again, and that's a typo there, because these individuals would not be required to be vaccinated, or they would be able to participate in the required biweekly testing. So in this case, for these limited programs, they would either be vaccinated or they would be required to continue with what you've already approved, which is the biweekly COVID-19 testing. These sports and activities include cheerleading, lacrosse, soccer, tennis doubles, volleyball, baseball, and softball. Again, the same requirements for fans, must be masked both indoors and outdoors, physical distance required by non-household members, attendance limited to parents or guardians, with two from the, designated by the athlete, no selling of concessions. And then the mask requirement would be required on and off the field regardless of the vaccination status. And the difference there is some of our high-risk sports where individuals wear mouth guards, and it's a safety equipment, and we've talked about at length about not having individuals with masks with safety equipment on. Our open sports programs, those programs have low risk for transmission. They would continue to operate with close monitoring of guidelines and restrictions in order to maintain low risk on and off the field. All students participating, again, would either be vaccinated or participate in the required COVID-19 testing biweekly. This includes cross country, tennis singles, swimming, and again, the same requirements for fans. And then the masking for the athletes would be required when they're off the field of play, again, because of low-risk transmission. We've already talked about cross-country. You're out in the middle of the woods, you're running, there's no one around you, mask can come off, put it back on if someone's near me, but definitely when I cross and I'm no longer running, I need to put it back on. Tennis, there's singles tennis, there's very low risk for transmission amongst players or between players on the court. It would be permissible because it's a low-risk category to allow those athletes to be unmasked. However, they would be required to put the mask on. And then swimming, obviously, very difficult to wear a mask while you're diving and swimming. So they would not have a mask requirement. If you can scroll down, I just wanted to give the vaccination status percentages as of 9/10. This is for our high schools. As you know, we're actively recruiting and seeking athletic directors for two of our middle schools, and so I did not want to report one middle school data and have it stand out by itself. So, but we did combine our high schools for the vaccination status as of last Friday. And I've been getting text reports tonight, and I think folks watching and have been looking, and we've had some folks report tonight, which is great. And so these numbers are already changing because I've gotten several reports. So we have about 5 or 8 more people that have reported their vaccination status this evening. Football was at 54%, cheerleading 52%, cross country 83%, soccer 73%, volleyball 60%, tennis 83%, golf I did not report because we have 5 or less participants, and with such a small number, it would be easy to identify individuals, and so we did not report those. Again, we have approximately 400 high school athletes. If you add all the percentages together, we're about 67% for our athletes. Although of concern is high-risk sports like football has not the lowest, but is pretty low as far as our vaccination status. which at 54%, cheerleading at 52%. Our sports with the lowest risk, tennis and cross country, actually have the highest percentage of students that are vaccinated. And then the reporting number of COVID positive cases was 4. That was primarily up until including the first week of school. However, we've already had 1 additional case reported today, so that number is now 5. So we're actively looking at that that was reported today. And I will stop there and take questions or comments from the board.
Thank you so much, Mr. Abley. I expect that this is going to be a fairly robust conversation, and now the presentation is done. If there are any burning questions from the board, we can take them now. Otherwise, I'm going to allow public comment, and then we can resume the conversation and the action for this. Everybody good with that?
Right.
Okay. So now is the time for public comment. After each speaker has been recognized and muted if they are unmuted, if they're virtual, they will have 3 minutes to speak. For folks who are in here, the timer is located right behind the board. It will count down once you start speaking. The board will not have a discussion with any speaker. No profane or vulgar language will be permitted or personal abuse against any person. Public comments should not address any specific confidential student or personnel matter. Complaints concerning any specific employee or student are not permissible during public comments. Speakers must keep their masks over their noses and mouths for the entire time they're speaking. Thank you. With that, I will recognize our first speaker. I'm going to call on in-person speakers first and then virtual after that. And our first speaker is Jamie Paulin.
Good evening, board. Thank you for allowing me to address all of you. I'd like to start by particularly acknowledging the chair and the vice chair. I can't think of a more thankless task than leading a school board during these really difficult times. I have a pretty good attention span, and frankly, listening to all of that information was a bit of a struggle for me. So particularly Madam Chair and Madam Vice Chair, thank you so much for your leadership. I just came here to speak very briefly on vaccine mandates. A few years ago, I listened to a podcast that was actually about the Iditarod. And the Iditarod, I don't know if any of y'all are aware of this, but the basis for that sled dog race was to get serum to Nome, Alaska, where children were dying of diphtheria. And diphtheria used to be known as the strangling angel of children. And regularly, children would die because they could not breathe because their throats were swelling. There was no vaccine at the time. There was a serum that apparently would help treat once young people became infected. And we now honor that incident with the sled dog race every year. I raise that because children died in a very, very horrible manner. They died not being able to breathe. And that sounds a lot to me like the description that I've heard of people dying from COVID, that it does not allow you to breathe, and that really seems to me to be a very horrible way to die. I personally because of my profession, was in a priority category for coronavirus for the vaccine, and actually struggled in the first month or so to be able to get that vaccination. I was very eager to get it so that I would not pass it on to my children or to people in my community. I got the first vaccination in March and then the second in April, and I'm very grateful for living in an era where this vaccination came out so very quickly. I heard another podcast where somebody described how to best fight a pandemic like this, and they talked about different interventions being like layers of Swiss cheese, and that no particular layer is going to prevent infection or end the pandemic, but by layering them on top of each other, would improve it. And so contract tracing, vaccination, all of these things that the district is doing are wonderful interventions. So my time is up. Thank you very much for allowing me to address you. And thank you all for all the work that you're doing.
Thank you, Ms. Pollan. The next speaker is Sarah Snipes.
Good evening, Board. First of all, a couple quick items. I want to call out the agenda items were not posted in time for tonight. So in the future, I would like us to have quicker access to that. We as parents are frustrated about last-minute agendas, that they're not transparent and not having meetings like the one on Friday. Just getting frustrated. First of all, so those are points of order. Question, how many Orange County students have been hospitalized from the virus? We're hearing a lot of these cases, and yet how many students are actually been hospitalized or killed? Do we have those numbers? Only 4, heard tonight, 5 positive cases. Diphtheria killed kids.
That was associated with athletics. I'll just throw that in there.
Okay. Another point is the board prepared for the staffing crisis due to the vaccine mandates? We just saw tonight stats that 25% of staff and teachers have not been vaccinated. And there was rumor last week that there was over 27 teachers and staff that were willing to walk out of AL standback. What's the plan for staffing shortages? We heard several areas, transportation, meals, that need help. Next item is about the numbers we just saw about athletics. I'm extremely frustrated. Where are the numbers for band and chorus and the robotics club and the computer club? It sure smells a lot like athletics is being discriminated against instead of the other the other extracurricular activities. Why is athletics and athletes being excluded? Is the board aware of a recently published medical study from the University of California by Dr. Tracy Hogue that provides direct evidence that teenage boys, this was just posted last week, teenage boys are 6 times more likely to suffer from heart problems after taking the shot versus being hospitalized from the virus? So is the board prepared to have athletes die on the field because they've been mandated to take the vaccine than actually recover from the virus? Data's out there. I've actually already emailed you all that article in that new journal study, so you have it. Again, 6 times more likely for heart defects. What about students that have already had COVID? Natural immunity, what's the status for that? All right, next topic, masks. I have family members that are firefighters. Has anybody, J.D. Hester I know was here earlier, has anybody researched OSHA statute standard 1910 that regulates employees are required to have 19.5% oxygen while working? There are studies out there where firefighters have put oxygen content in masks, and N95 and cloth and other ones don't meet it. At 14 to 16% oxygen, people suffer from asphyxia. Who's ever gotten a headache from a mask?
I need to ask you to wrap up, Ms. Snipes.
I'm trying to. Who's ever gotten a headache from a mask?
I need you to wrap up immediately,
Okay.
please.
Last step. 16% oxygen can cause tachypnea, tachycardia, impaired attention, thinking, and coordination, even in people who are resting.
Thank you, Ms. Snipes. Thank
We're going to
you.
be suffocating our children.
Have a good
We
night.
need to look at those numbers.
The next speaker is Jackie Wieland. Welcome.
Thank you very much. Thank you, Board. And I just wanted to go over a few points. A vaccine usually takes 4 to 15 years to create. There are no experts in mRNA. It's too new. They tried it on Ebola and it failed. Their children are normally mildly symptomatic to asymptomatic. So are we going to start mandating the flu vaccine? Because actually that's more harmful than the COVID on children. You're talking about healthy athletes and worried about COVID. I don't know. I just don't think you're doing the research. I have been teaching in class for over a year. The numbers are inflated. I go in every day like a soldier, willing to do whatever it takes. And I'm tired of hearing people wimp out and believe that this is as bad as it is. get educated on the risks. Other countries are watching us. People come from all over the world for excellent medical care. Why are medical professionals not willing to take the vaccine? Why? Because they know that it took very little time for this to roll out. Okay, there are blood clots and other horrible things that are happening. Look at the public and the private schools that have been in the battle since the beginning. Look at Thales Academy, year-round, one of the first ones that got back to school. Why would we think we want children to take the risk for any health issues in the future? Sterility, heart defects. And you think it's okay just to say, yeah, just get them vaccinated. And I care about older people too. We don't know that much about the effects of this vaccine. And I agree with the previous speaker. I've seen reports about myocarditis. Okay, that's all I have. But I mean, I appreciate everybody working as hard as they do, but how dare you put our children at risk for something that a healthy child, a healthy adult, doesn't even have to worry about? You get it? You get it. Most of them are mildly symptomatic to asymptomatic. It's unconscionable.
Thank you, Ms. Whalen. Christina Clark.
Hi, everyone. Good evening, Dr. Felder and school board members. I just want to quickly acknowledge Nurse Compton, who helped me today, actually, in my second block class. They're working so hard, and they're doing their regular jobs, which were already overwhelming, and now this contact tracing on top of that is just a ton. All right. As the president of the Orange County Association of Educators, I hear every day from educators around the district. These first weeks have been overwhelming for all involved. Although we're thrilled to have students back and we're glad safety is prioritized, the packed schedule and extra duties are putting everyone on edge, including students who are bewildered by new fluctuating routines and strict COVID protocols. While we are all still adjusting, staff have been asked to cover more responsibilities than ever before. They are arriving early, staying late, skipping lunch, losing their planning periods, and most commonly covering for other staff. We've not had enough substitutes to stand in for staff, even in the first couple of weeks. This means that elementary teachers and assistants are pulled every which way to cover all manner of activities. Middle and high school teachers lose their planning at the last minute to cover classes that substitutes would normally be paid to cover, and they're all doing it for free. When are we supposed to have time to analyze student data so that we can meet our students where they are after a year of remote learning? Students need us at our best right now, and we can't do that when we're spread so thin. When teacher time is abused, everyone in the school suffers, not just teachers. School administrators across the county are taking the brunt of both parent and teacher complaints as they try to keep everyone safe by enforcing protocols and assigning duties. Front office staff are getting an earful of abuse daily that is not making it to district staff in their downtown offices. We propose a few solutions to alleviate demands on staff time. First, staff should receive compensation at least equivalent to substitute pay for covering someone else's class. This system is already in place in Durham County schools and would provide incentive for staff who can afford to give up some of their time. Staff should also receive aftercare pay when they stay late to supervise students. Second, we'd like to see central office staff step up and cover supervisory duties to give our administrators a break. Third, we need to hire more personnel to cover supervisory duties that do not require a licensed teacher. Consider these measures or you will lose staff to burnout, which will be detrimental to our students' educational recovery. Show us that you value our time. We want to teach, so protect the time we need. Thank you very much.
Thank you so much. The next speaker is Tim Zachary.
Went to school with my daughter. Okay. I came up here because my family has been in Orange County for 272 years. They were part of the Quaker settlement over here in Snow Camp. That my family were educators, and they taught the black children how to read and write and helped them escape on the Underground Railroad. I'm wearing this dumb costume because my great-great-grandmother on my mother's side was give to a white man at 14 years old in 1829 so she didn't have to walk on the Trail of Tears. I have a 6-year-old son that went to pre-K, he went to virtual K, and he's supposed to start first grade at Grady Brown. But because his moderate or severe allergies and he has a reflux swallowing disorder, he can't wear that mask. There's no exceptions. I don't know how many trips and how many phone calls and how many emails I've sent from my son. Because the first 2 weeks he sat home on the couch because nobody called me back. So I had to enroll him in Achilles virtual school because Orange County couldn't help me. So after 272 years in this county, my son, the last Zachary, don't have a place in your school. So if you're going to mandate a mask, you're going to have to mandate something for people like me. That's really all I got to say. I stood over here for 3 hours and listened about COVID instead about how you're going to educate our children. Let us take care of our own health. That way our families won't be walking down the Trail of Tears someday by some do-gooder society. And, you know, I said I don't really want to use profanity, but my grandmother used to say this: the road to hell is paved with good intentions. And sometimes that's the way it is. So thank y'all for listening. Like I said, my son has been sitting on the couch because nobody would help me. Nobody in the system. And I've been to Grady Brown and I've talked to everybody would listen. And I always end up with the same secretary at Grady Brown, and we have a big laugh over nobody cares. Think about the education and forget about COVID. So thank y'all for your time.
Thank you, Mr. Zachary. The next speaker is Tanya McFalls.
So I'm here to speak about the mask mandates and the upcoming vaccine mandates that are being pushed upon the children and staff of Orange County. Is this not the land of the free? Do we no longer have a choice in what we can do with our bodies and our children's bodies? What happened to my body, my choice? Do we live in a communist state, or is this a state that stands for first and freedoms? The PCR tests are fraudulent, and they do not need to be used for identification of a virus. The CDC has even stated we are no longer to be using these tests, that they cannot distinguish between the common cold, flu, pneumonia, or the COVID-19. In fact, if you want to slow the spread of the Delta variant, then you should stop injecting the spike protein toxins into the bodies and transmitting them to everyone else around them. Injection equals infection. The vaccines do not work. Stop the infection. This is not about public safety. We know what this is about. This is about funding, and we all know, all of you love funding. We know this. You're merchandising on our children, and we, the people, have had enough. We stand for freedom, and we have a choice. This is not a dictatorship. You're running it like it's a dictatorship. We don't answer to you. All of you work for us. You are elected officials. You work for us. And just so you're aware, I have every one of you's oath. Every one of you. And you're going to be held accountable for everything you've done. You're wrong in everything you've done. And let me just be clear on this. That flag hanging back there, that's a terrorist organization. Black Lives Matter flag in a school? Are you serious? Where's the American flag?
Ma'am, you need to pull up, ma'am, you need to pull up your mask. Thank you.
First off, the masks don't work. That flag back there is the size of a magazine. That's unacceptable. You didn't even want to say the Pledge of Allegiance. How does that make you look to the rest of us? Think about it. We see you.
Our next speaker is Jen Olson.
Good evening. First of all, I'm very disappointed that not one of tonight's agenda measures covers the educational loss that our students have encountered and the statistics surrounding the EOGs in our district. The impacts of COVID closure have been widespread. The performance of every student group reported has decreased by at least one grade level. Let us begin by not exaggerating the novelty of our situation. Believe me, dear sir or madam, you and all whom you love were already sentenced to death before COVID was invented, and quite a high percentage of us were going to die in unpleasant ways. We had indeed one great advantage over our ancestors, and we have that still. It's perfectly ridiculous to go about whimpering and drawing long faces because the scientists have added one more chance of painful, premature death in a world that is already bristled with such chances and which death itself was not a chance, but a certainty. This is not about left or right. It's not about our liberty. It's about our Constitution and our freedoms. When you are creating a division in an already divided society with vaccine mandates, who do you think you are hurting? When we know minorities are the most vaccine hesitant group. This is coming from the racially inclusive Orange County School Board. These mandates are the ultimate workaround. You heard me, the ultimate workaround. What am I talking about? I'm talking about the US Constitution. It's a workaround. You have to work around it. Okay, so why is this the ultimate workaround? It must be that if this works, you can work around everything else in the Constitution. You'll never need another workaround again. This would be the ultimate one. People should not be cast aside because they made a medical decision for themselves. They should not lose their jobs. They should not be unable to put food on the table just because they made a different decision than the powers that are demanding they make. If the school board can get away with this, I ask you, what is going to come next? I would generally say when you're taking action that's unconstitutional, that threatens the jobs of the people in my state, many, many thousands of jobs, I'm standing for them. We're going to protect the jobs against this overreach. And so these are times when, if you believe in the Constitution, you've got to stand up. Obviously, the substantive issues are important because there are places that are going to toss aside people who have worked this whole time throughout COVID, and now all of a sudden they should be tossed aside. Now all of a sudden they're dangerous. They were working when nobody had vaccines. You don't know their history. You don't know the reason they are making these decisions. Many people have recovered and have immunity. That immunity is strong, so this is not based on science. You want to test the unvaccinated students when we know for a fact that vaccinated can catch and spread COVID. So these mandates are not science-based. Test one group, test them all. Nobody should lose their jobs because of this decision. Line drawn.
Thank you, Ms. Olson. I hope that you'll stay around for item 6A, which is actually student accountability results from last year, and item 6B, which is the strategic plan, which is how we intend to address them. The next speaker tonight is Anthony Cecil.
Thank y'all for this time. I'm not really a public speaker. Really care about kids. I have two freshmen at Orange High School. Both of them are athletes. I'm also a coach here at Gravely Hill Middle School. I'm here to voice my concerns about the possible suspension of the so-called high-risk sports in Orange County. In reality, this suspension is only affecting one sport, and that is football, because all the other ones are out of season. I don't understand the reasoning behind it, since there are no COVID cases involving football teams that I know of in Orange County. Plus, I only know of 2 cases at Orange High School that affected other sports. And those 2 cases, from what I'm hearing, contact where they attracted it from the school system. They're not recommending us to shut down any other sports, even though some of them are inside. Central office says that Orange County Health Department and Duke ABC Collaborative recommending this. They recommended it. Why aren't they recommending it for University and UNC? Why aren't they shutting down their sports? Why are we here in Orange County? We have one of the highest vaccination rates in the state. Anyone over the age of 12, we have 71% vaccination rate. Over 65, we have 95%. That's from today's updates. I've got more calls. I've got a call from the nurse, but that exposure was in the classroom. It wasn't on the athletic field. It wasn't out. It wasn't when they was outside. I'm also concerned about the board making vaccine mandatory for all the student athletes, because we're going to lose some athletes. Today, especially here at the, that for the last year, home in front of computers, or whatever, trying to get them healthy. I've been overweight. I don't want them to go through what I've been going. So right. If the mask, with the vaccine, I made a decision to vaccinate my family. So a lot of what's being not going to affect me, but everybody should have the same right. My decision. Y'all made y'all's decisions on y'all's vaccine. One of these people have the same right to make it for their families.
Thank you,
No government entity.
Thank you, Mr. Cecil.
Thank y'all.
Our next speaker is Deanna Smith. Welcome.
Good evening. I've never done anything like this before. I'm much better in writing. Y'all have an email that I sent earlier today that took several hours of my time to compose. Got links to data and when I base my decisions. I have 2 children in the school system, a senior and a 7th grader. My senior's been, sorry, emotional. She can't be here to talk because she knew she couldn't get through it. She's been a 3-sport athlete since 7th grade. She played all of last year on a basketball team that had 5 players. No vaccinations, no cases, no problems. They work their butts off, and they need to be able to have the right to choose whether or not they get vaccinated or not. Transmissibility does not equal mortality. Right now, according to the CDC COVID tracker, we are at the lowest death rates than we have been all of last year without vaccines. Stats started dropping in January, early January, prior to all the people actually getting vaccinated. The facts that asymptomatic cases, according to the CDC, there's 0 evidence of asymptomatic spread. There's testing will just add to the burden of all the school nurses that are already saying how overburdened they are with the testing practices and or with the contact tracing of actual COVID cases that have symptoms. The population in these age groups at school have the lowest risks of adverse outcomes from COVID. While there has been warning labels added to the fact sheets for both the Pfizer and Moderna shots of increased risks of myocarditis and pericarditis, they do not know what these shots are going to do long term because this data and safety trials are still going on and they're still collecting all that data. And so these are just 2 of the things, myocarditis and pericarditis, increased risks that they've seen so far. The main point is school sports may seem optional to many of you, but for many kids, that's how they get through their day. They look forward to sports at the end of their school day. And that gets them through school. It gives them the opportunity for the physical outlet. And for many kids, it's their only opportunity for scholarships or having other colleges look at them and have extra opportunities. I appreciate what the school nurses are doing, but also with the rapid tests, they have been recalled. The RT-PCR tests have been recalled. And so I'd appreciate not having a recalled test used to determine whether my kid can or cannot play.
Thank you
And
so
that's it.
much. Our next speaker is Gretchen Schmid.
Good evening, everyone, or should I say good night? It's getting late. I am representing on behalf of Moms for Liberty Orange County chapter, and just a little bit of housekeeping on the logistics of the publishing of the agenda. I also did not see that. I didn't check right at noon on Friday. It was a couple hours later. And on the goal of transparency in regards to human and financial resources, I was hoping to find out when we could see the minutes and, or even better, just a replay of the training on Friday. As far as athletics go and the vaccine mandate to teachers and the potential for students, what we have is still a situation where an emergency authorization use. What was approved by the FDA without any public hearing, without any expert witnessing, without any review of the test that actually ended back in December because they gave most of the placebos the vaccine. It isn't even a viable test anymore because of how that happened. What has been approved has not even been manufactured yet. You can research this yourself and find out that the vaccine that has been approved is under the Comirnaty brand, and it's not even manufactured yet. There's a letter stating that the Pfizer vaccine that is out, that they're passing off as having been approved, is still under emergency use authorization. And no teacher, no student, nobody can be forced to be part of an experiment, even after it's so-called approved, by no basis of any basis in history of approval of any medicine or drug. Like our neighbor before with sports, that's how my son gets through school. As a dyslexic student, he tries his hardest all day to concentrate, and sports is what makes school tolerable. And he does very well as a student athlete. I would hope that, like others here, that the focus would be on education. And if you can go to Johns Hopkins and look at their study on all the stats from last year. If we take a little higher view, and the poor nurse that was here explaining everything, we can see that in 2020, there were no more deaths in any age band than in any other year. And we chose to focus on COVID instead of car wrecks or the flu or any number of things that could have been focused on. There were no more deaths in any age band
Thank you,
in the
Ms.
year of
Smith.
2020.
Thank you. Good night. Our next speaker is Bill Wicker.
Good evening, everyone. I just want to go on record and state that I never give consent to having testing, vaccinations to my children who are in schools. That's what was going to be heard primarily over. My voice has not been heard before. I reached out to you guys through Jeff Racklin, principal at Standback, and through the mandates, ironically, the illegal mandates that don't trump the Constitution or our inalienable rights. Gave exemption to my youngest son, autism, Down syndrome, XYY syndrome. Specifically, exemptions in the mandate, ability yourself, share one. So isn't that ironic? I'll tell you something else that's a little bit ironic. My son is prescribed to glasses. No educator has been able to get my child to keep glasses on his face in years. You guys sure have trained him like Pavlov's dogs to wear this piece of crap that I can't even keep as I try to speak to you. Just really here to very thankful that I'm able to put this on record. I'll state something else. If you're going to try to get people to buy into something that you want to mandate, you should at least provide to them isolated strain through North Carolina Department of Health and Human Services. You should provide to them an isolated strain of the SARS-CoV-2 infection, which is what all of the mandates, the implementations, constitutional actions that are being taken against our freedoms and our children's freedom. Also, if you are going, my son is nonverbal. Others out there who are not, does not have the ability to tell you what he's uncomfortable with, how he feels about breathing with the mask. You guys don't even monitor his O2 saturation levels or any of these other kids. All of these kids who have to wear a mask, you're going to make them wear a mask and not even monitor their O2 saturation levels. And we all know that CO2 is toxic going into the body. We all know this. So, last thing, I don't know what you guys were expecting from me, but I think I'm just giving you some hard facts. Might as well tie millstones around your neck and throw yourself into the sea before you mess with these kids. That's what Jesus Christ
Thank
says.
you, Mr. Wicker. Have a good night.
And
Thank
I will
you.
inform you that you're in
Night.
violation of the U.S.
Your mic will be turned off, sir.
flag code. It's supposed to be the most
Thank
prominent
you.
in the room. Okay, thank you.
Thank you. Our next speaker is virtual and is Laura Streitfeld. I do not have you on my list. I don't know what you're holding up. Let me take Ms. Streitfeld and then we can discuss this. Ms. Streitfeld, go ahead. Welcome.
Am I unmuted?
You're unmuted. Welcome.
Thank you. Thanks very much. Yes, I heard a number of concerns tonight and from folks with different perspectives, and yet there was something that I heard in common, and that was that in terms of how COVID is complex, you know, I've heard it's been a sobering meeting. We heard from the school nurse and from school administrators about the compelling numbers of cases and concerns about how contagious Delta is. But there were also concerns from a number of parents about treating children, separating children by whether they were athletes or not, testing one group and not the others. And as one person said, if you test one group, test them all. And if the county opened without the ability to trace adequately the number of cases that are starting to show up and to investigate the 800 cases related to, I did a little number crunching listening to you, related to the 76 total cases that are on the dashboard for the district in the last 3 weeks, resulting in 800 case investigations, then what you need is a layered approach. You need every tool in your toolkit so that you can keep schools open for the families who want kids desperately to be back in school, and to do early detection so that you catch cases before they spread, before they start to quarantine and shut down classrooms. And I would suggest that separating kids by athletes and coaches is a mistake, that opting in is a mistake, and that there are ways to do comprehensive, just the way you're masking, ways to do testing that are minimally invasive. They're not as invasive as last year's PCR tests for children, and that early detection is our way out of wearing masks and our way out of this pandemic as another layer, and as someone said, the Swiss cheese model. With Delta, the greatest risk is to the unvaccinated, and yet the plan is to aggressively test and possibly vaccinate 600 students out of 7,000 something students who represent 8% of our students in our district. Yet there are 2,700 vulnerable elementary students. That's 37% of the kids in our district who are not eligible to be vaccinated. They're the most vulnerable, and yet we're choosing to test 8% of athletes. Now, if you vaccinate the most, if you opt in to an effective public health measure, you're not protecting the most vulnerable. Universal masking is what you all voted on, and universal testing, together with the distancing and outdoor eating, will get us to a place where you identify cases. Early detection is another way to think about monitoring, so that you're testing folks for the asymptomatic cases, which make up about up to two-thirds, half to two-thirds of cases. And I think you're using last year's models for looking at who to test. We hear that there are 5 cases of athletes. That's 6% of the cases in our schools this past 3 weeks.
Thank you,
So
Ms. Streitfeld. I'm gonna have to
I'm
ask you
going
to
to
wrap.
ask you to strongly consider universal testing. It can stop, you can catch 80% of your cases, whereas with just masking, you're only going to stop about 50% of your cases. And I'll send more information that I'd like to share.
Thank you.
Thank you.
Thank you so much. Have a good night. Ma'am, what was your name? Hold up.
These are your athletes of Orange County. They were not allowed to talk tonight. They were told they were too late. I think they should be our voice. But I'm going to be the first one to say, I'm not trying to come and start anything. I'm not anti-mask. I'm not anti-vaccine. I can tell you firsthand, I understand COVID more than anything. I lost my mother in January to COVID. She fought cancer, everything. So I'm neither side, but I think it's your body, your choice. Also, I've been in pharmaceutical research for 20 plus years. I won't get into that whole thing. I've studied oncology, different things. It's a virus. I did research on Tamiflu for the flu, but I won't get into that. My problem is that it seems like the board's decisions are being made in a vacuum. Let's ask our parents, our athletes, what they think. As a parent, and as especially high school kids, I gave my daughter the right. It's your body, your choice. If you decide to be vaccinated, I'm fine. If not, that's your choice. But let's just stop deciding, the board's deciding in a vacuum what's best for our kids. Ask the parents, ask the athletes. What do they want? As a parent, I can tell you right now, if I was worried about my child getting COVID, she would not be playing sports. We have represented here softball, volleyball, football. I wouldn't let her play if I was so worried about that. Our kids are playing, what you guys don't understand, with their athletes, they are playing travel sports. They're going to concerts. Luke Cohn was just Friday and Saturday. How many of our students went to that? UNC is in Orange County schools. They're still playing football. State, everybody else is still playing. Do you think they've canceled it? No. There have been 5 confirmed cases of athletes in Orange County schools. That is less than 1% positivity. Why are we've taken so much from our kids already. Why are we taking their ability to play what they love? It's like someone else said, that's how they get recognized. That's how they get scholarships. I so hope my child gets a scholarship and can further her education in college. And on another note, our governor just last week said that he would be attending outings outside, including sport events. But we keep talking about how it's mandated and how so-and-so recommends it. But our governor can attend these events, but our kids can't.
I don't get it. It makes no sense to me. Let our kids be kids. You're not mandating they can't go to travel ball and not even wear a mask. You're not mandating that they can't go watch a UNC game or go to the PNC arena, watch hockey, UNC, anybody else without a mask. Let them be kids and concentrate on their education. That's all I have.
Thank you. Our next speaker, which is virtual, is Jackie Barker.
Hello?
Hello, welcome.
Thank you. Safety protocols in place are contradicting and full of holes. These policies are experiments of trial and error. Children are being treated as test subjects, and even more so if the mass COVID test is approved. None of the COVID tests are FDA approved, so again, it's all an experiment. The ABC Collaborative that you are advised by even stated in their recent yearly review, there is no existing data to support the need for screening testing to ensure safe in-person education when masking is in place, which also means there is no data when masking is optional. Now, my issue with mealtime is my child has been unable to finish eating lunch during the allotted 15 minutes of silent lunch since school has started. Even with students not being allowed to talk, there's still not enough time. The majority of the time they're eating outside. We're told that's safer, right? So why can't they talk out there? Where's the current data or science that COVID is spreading while they eat lunch and talk? Are you going by the data presented to the school from last school year that found 2 COVID clusters in the special needs environment, only 1 linked to children eating together? This is not enough data to support the current lunch policy, another blind test being pushed on our kids. We can go and eat at any restaurant in town and kids are allowed to talk. COVID's not spreading in the restaurants and there's no time limit for eating. I guess COVID can only be spread by children when they eat and talk at school though. Why is Orange County Schools one of the only schools with silent lunch policy? My son goes to a K-12 school in this same county and they get 40 minutes for lunch indoors, are allowed to talk. There's been 1 case of COVID since the school started almost 2 months ago. Just 1 case. It was likely community acquired and not from talking during lunch. Please give these kids more time to eat and be allowed to talk. The only time they get a break from the mask at school is during lunch, and that's not enough time for a mask break since they don't get a mask break outside at PE or recess. I guess COVID only travels in the air outside Orange County schools because other schools in this county don't require students to wear a mask outside. If you're all going to keep mandating masks, then students deserve to get a mask break. My daughter has headaches and jaw pain from wearing a mask 7 hours straight. Some wear them even longer that ride the bus. For reference on a mask standard, OSHA and the Surgeon General require masks to be removed every 2 hours for a minimum 20-minute break. Let's also consider a current study from June 2021 on children's face masks found 11 pathogens like pneumonia, tuberculosis, meningitis. Pay attention to how many times each of you will touch your mask during this meeting. Imagine how many times a child does this throughout the entire day and never changes out for a clean one. Some kids wear the same one all week. If masking continues, parents should be informed of the following. Prolonged wearing of a mask has been known to cause impaired judgment, impaired ability to learn, impaired ability to focus, impaired ability to retain information, causes irritability, blurred visions, headache, lung infections, eye infections, TMJ, and other ailments. If you choose for your child to wear a mask, the mask must be cleaned and changed every 2 hours. Proper oral hygiene guidelines must be followed for your child to wear a mask. One must bring to school mouthwash, toothpaste, dental floss, and toothbrush in order to prevent pneumonia, gum disease, tooth decay.
Thank you, Ms. Barker. Thank you.
Thank you.
Have a good night. Our next speaker is Chris Roman. Is he there? Is he unmuted?
So I don't see him in our list of attendees.
Okay, we'll move on to the next one and we'll check one more time at the end. Jessica Harrell. Is someone speaking?
Yes. Can you hear me now?
Oh, yes, I'm sorry. There was some other noise that I thought was someone trying to speak. Okay, yes, welcome, Ms. Harrell.
Okay, thank you. All right, so thank you for the opportunity to address the board. I realize emotions are high. but we all want what is best for our kids. Unfortunately, we differ on how we're going to get there and what exactly best for our kids means. So for some context, I have a PhD in cell biology. I am employed at Duke University, and I have followed the data and science closely. Masks are obviously helpful, absolutely helpful in containing the spread of the coronavirus, and vaccines are safe and effective. Any claims otherwise are not based on scientific data and evidence. My initial gut reaction to the recommendation to suspend high-risk sports in Orange County was that it was an extreme measure. However, I wanted to understand where this recommendation was coming from, so I dug into the CDC recommendations today and the current numbers in Orange County to understand where the recommendations to suspend athletics were coming from. As Mr. Abele explained, the CDC defines high transmission as greater than 100 cases per 100,000 people. There are currently 407 county. So this puts Orange County into the category of high transmission. Based on high transmission, CDC guidance for K-12 schools says cancel or hold high-risk sports and extracurricular activities virtually to protect in-person learning, unless all participants are fully vaccinated. Given this guidance by the CDC, the OCS recommendations align with scientific recommendations. Ultimately, we all have a responsibility to bring the high transmission rates down in Orange County so that athletics can safely resume. I ask everyone listening to consider whether you are doing your part to contain the spread so that we can get our kids back to participating in athletics. There's plenty of data to tell us that doing things to mitigate the risks can be effective, including vaccination. I also want to address, there was a mention of the data in the paper from the University of California about the myocarditis. To be clear, this is a preprint paper, which means it hasn't been peer reviewed. It's also based on data in the VAERS system, which anyone can report a case here, and it's not verified. Their website even says the reports may contain information that is incomplete, inaccurate, coincidental, or unverifiable. So to be clear, the conclusions in this paper about myocarditis aren't necessarily reliable. I want to address one other area of concern that is pertaining to contact tracing. As we heard earlier in the meeting, 3 to 6 feet of distance is not currently occurring on the school buses. And if this is the main area that kids are going to be identified as close contacts, I'm afraid this could disproportionately affect kids who have no choice but to ride the bus. I'd like to see Orange County examine the policies and procedures to minimize close contacts on the bus. And additionally, in the event of an exposure and ultimate quarantining, educational materials and resources that are being provided to these kids at home seem to vary greatly. Some are getting materials and support from their classroom teachers and others are not. And so I would like to see some policies, procedures, and structures in place to keep the children who are quarantined at home engaged.
Thank you. I'm going to have
Thank you.
Thank you so much. Have a good night. The next speaker this evening is Katrina Wesson. Ma'am, I'm going to have to ask you to stop interrupting the meeting or I'll have to ask you to leave. Thank you. Thank you. Katrina Wesson. Are we able to find her?
I don't see her in the list.
Okay, Ron Crawford. Do we see him in the list?
I do not.
Joe Todd is saying it's Ron Crawford. Can you double check that, please?
There he is. Let me unmute him here.
Hello?
Hello, Mr. Crawford. Welcome.
Hey, thank you. Yeah, my name is Ron Crawford. I have 2 kids in Orange County schools, and I wanted to comment on the recommendation to shut down certain sports for 2 weeks, which was issued yesterday. The basis for the recommendation is because of the high rate of community transmission of COVID in Orange County. And I want to say that I'm in favor of masks and vaccinations. However, I think there are several measures that may indicate that it is not necessary to shut down any sports teams at this point. First of all, the CDC looks at the number of positive cases per 100,000 residents per week. And in Orange County right now, that's 213. An earlier speaker misspoke. It's not 476. It's 213 according to the DHHS dashboard. The CDC says it should be less than 100. It's over 200. However, the CDC also looks at the percentage of positive tests and considers anything under 10% to be low. Right now, we're at 3% in Orange County. And it appears that both of these numbers may be trending downward. I also want to note that Strong Schools on Sports refers to the document called Interim Guidance for Administrators and Participants of Youth and Amateur Sports Programs, which is also cited in both the recommendation before this board and in the DHHS alert about clusters. And there was nothing in that report about shutting down any sports. In fact, the alert from DHHS last Wednesday that called attention to sports clusters did not say anything about shutting down sports. Mr. Obley pointed out that vaccines work, and I completely agree. An earlier speaker said that 71% of Orange County is fully vaccinated. Well, with due respect, the DHHS today says it's 79% of Orange County is fully vaccinated. The Orange County Health Department says that in the most recent 2 weeks available, there were 18 COVID cases in kids 15 to 17 years old. That's August 29th, there were 11 cases, age 15, 17. September 5th, there were 7. So in 2 weeks, there were, and that's not Orange County schools, that's not Orange County athletes, that's population of Orange County, age 15 to 17. Mr. Obley's report, in fact, says that high school athletics, 5 positive cases total out of 400 athletes. Finally, there's no reason that we cannot implement, or it would actually be re-implementing the social distancing measures for sports that Mr. Obley listed immediately. There's no need to wait 2 weeks for that. And we can let the athletes continue to participate safely until we have a clear indication that there's an urgent need to pause their sports.
Thank you, Mr. Crawford. Have a good night. Can you all double check for Chris Roman one last time? C.
Still not seeing Mr. Roman here in my list.
Okie doke. Well, then that concludes our public comment for this evening. Thank you to everyone who came out to share their feedback with us. And with that, we will move into our action item for health and safety updates. Mr. Abley will come back up and we'll ask questions and make comments about the recommendations about sports. Would anyone like to kick us off from the board? Ms. Hauser?
I just have a question. It was raised by several speakers, and that's why are we singling out athletes when our data suggests that our bigger problems are in elementary school? Athletes are doing pretty well in terms of their compliance and their
question for me.
Yeah.
One is, when we presented information last month, we said we would be back with an update prior to September 15th and review the data trends and the information before us. We know where we are at this point with our community transmission. We also know the number of cases we're dealing with within the school day. As part of that review, we've been in constant contact with the ABC Science Collaborative and the Orange County Health Department, reviewing cases. Although our case counts, and I agree, are low because we do have things that are working correctly, with our athletic programs. We have other sports and programs, and especially workouts that have just started. When we looked at the case counts, those were primarily the week prior to school starting and the week of school starting. And those additional off-season sports had not yet, my understanding was, started at that point in time. So we have a large number of athletes, not only that will be or were participating in fall sports, we now have off-season sports that are adding to that as well. We also need to make sure that we have the best recommendations and guidelines, as was mentioned earlier, not just for the players on and off the field, but also expectations when it comes to masking and any expectations for fans or other individuals attending events. Talking with the schools the past couple of weeks, there's been a lot of confusion about the mask requirements, fan requirements, individuals coming to events, even students on a school campus who should be masking were not masking because they were attending an event. And so we need to be very clear and consistent about what our expectations are. So the pause, again, was not a cancellation, it was a pause. And I want to be clear about the recommendation was not a cancellation of the sports season. This board has every right to cancel all sports and athletic programs effective immediately. That was not our recommendation. Our recommendation was for the highest risk sports, pause for 2 weeks. Make sure that we understand any data or metrics that we're going to be gathering or collecting. Have very clear and precise protocols is what we expect on and off the field. And then also make sure that we have a robust testing program that you all had asked us to do and to implement. And the understanding was, had we been prepared and ready, that would have been in place prior to them ever being allowed to start and engage in the athletics that they're undertaking now. So we're a little behind in that process. But what we need to protect is making sure that the case counts remain low, that the transmission and secondary transmissions are zero. That's our goal. And that the students can remain healthy on the playing field. As I stated earlier, we have another case today that does involve athletic programs, and there is more than a dozen individuals who are now receiving information tonight to quarantine. So we want to make sure that we're proceeding as expected. And yes, this certainly is information that's coming quickly, but it's also information that we're getting and gathering just as soon as we can. And we did say we would thoroughly and review prior to the 15th. High risk is high risk. That's the targeted area that we asked to pause in. The remaining sports programs, the other 5, 6 athletic programs that are operating, we're not asking those to pause. We didn't make any recommendations for those to pause. What we recommended is we put limitations on how those programs are operating and clarifying mask requirements for those students. We know our students don't just compete in Orange County. They compete outside of Orange County, whether it's in conference or non-conference events. There are varying degrees that we're going to put our athletes at risk when they travel to a venue outside of our county. Orange County has been at the forefront of being ahead of any recommendations and requirements. In fact, there were a series and number of executive orders issued in Orange County last year that were well beyond what the governor issued. That has contributed to where we are today with a community that has responded well to this pandemic. We also know that we have a large majority of healthcare that's located in Orange County, both from the Hillsborough campus and from Chapel Hill. We know that we also have community healthcare agencies that are very close by with Duke, Piedmont Health, Wake Health, Rex Health as well. Those facilities are dealing with a large number of COVID cases. We do not want to contribute to what they're dealing with. So as part of the community, and we are the community, we need to make sure our protocol and processes don't contribute to an overwhelmed healthcare system. We felt like 2 weeks would allow an opportunity to review the protocol, ensure our athletes are as safe as they can be, and then restart the programs. Certainly, the vaccine mandate is a separate item. We can address that separately. But I think we all would agree that doing what we can to protect individuals on and off the field and protecting our in-person learning is critical and vital to us having a successful school year. I hate the fact that we have to make a recommendation for students who have already started playing. I would much prefer if we have to pause or stop or have a shutdown, we do it prior to the start of a sports season. However, knowing that inclement weather impacts athletic events all the time, we deal with them 24/7. We know that sometimes it's a week or two before games can be rescheduled, fields dry out, there's whatever issue we're dealing with takes care of itself. And so asking teams to not play for 2 weeks is not something that we haven't done before when it comes to inclement weather or waiting on fields to be prepped and ready. So we did feel like 2 weeks was an appropriate amount of time. We're not talking about 30 days. We're not talking about 6 weeks. We just asked for 2 weeks to allow us to review this, make sure we're solid in our recommendations. We have a lot of new coaches. You saw your personnel list tonight. We have new individuals coming on teams every single day. Have to make sure they're trained, that they understand the protocol, and they know the expectations. That's very difficult when you know the list. You see the individuals we bring before you with coaching recommendations. So all of those individuals also need to protect and be aware of what the requirements in the protocol are. So I think it's more than just one thing. It was accumulation, seeing the data, seeing the information, reviewing, and a rightful question. Why are we wanting to do something different for athletes? It's because of where they are, the numbers that are competing, the numbers are on the field, and the risk that's associated each day. I know earlier it was mentioned extracurricular was not in the information tonight. That's correct. We will be reviewing and bringing back the same exact information and any additional recommendations when it comes to other extracurricular. It was not intentional to single out athletics in isolation. I hope that answered your question.
For clarity, when you say suspend football, you mean practice everything. It's not just suspending games.
That is correct. 2 weeks, there would be a dead period. There would be no practices, no playing. That would include the off-season sports for the high-risk category programs only. Not all athletes, not all athletic events, just the high-risk events for 2 weeks. And I would have that recommendation regardless whether or not you believe that tied to that recommendation should be a vaccine mandate. I have seen, witnessed, we have a breakdown in our requirements, recommendations, and protocol. We need to clarify. We need to help folks understand that our job is to keep everyone safe.
Other questions, comments?
Miley?
On that last point, Mr. Abley, the breakdowns that you're seeing in protocol, are those sort of related to spectators and things? Is that related to actual sports teams, sports practices?
Yeah, it's both. I mean, certainly, what we try to do is investigate, and we try to, in fact, I had a meeting last Friday with athletic directors and just walk through not only expectations, making sure we were clear that we were on the same page, but also protocol for contact tracing, making sure that we're clear about what's expected for contact tracing, documenting. An example, that I talked about was documenting and keeping information on where individuals are. Give an example, 15 people on a volleyball team, or when I used to coach basketball, 10 players on a basketball floor. Usually the protocol is you have seats lined up on your sideline. They go in the game, they get whistled, they get out of the game, they go back in the game all night long. It might be difficult because I have to look back 48 hours to see who was close contacts, not only on the floor, but sitting over on the sidelines as well. And sometimes, for whatever reason, injury or, students may not play any playing time during the game. But when Patrick's on the floor and Patrick's off the floor, Patrick should always be sitting in chair 7. Real easy process we can put in place. When I'm on the floor, my chair's empty. I'm off the floor, chair 7's open. That's my chair. Go right back to it. Whoever's in 6 is always in 6. Whoever's in 8 is always in 8. So we need to make sure coaches understand that when we have a case, knowing that information and being able to track it and document it is critical. So it's about also keeping documentation and records. And I don't know, we clarified what detail and level that was. So we're not talking about negligence. We're not talking about, things that may not be happening with ill intentions. Sometimes it's just clarifying what expectations are and understanding the process we have to go through to do that contact tracing. When it comes to masking, there is no real clearer definition than the mask has to be over your nose and underneath your chin, covering your full face and being worn properly at all times. Yet we still see individuals not doing that. I saw individuals not doing that last week. In fact, I've been visiting games and things. My athletic pass is right here. I'm ready to go watch our athletes and go see them. And so when we have breakdowns, we've got to help coaches understand you're there. You have to, I can't be at every game. We can't have like we talked about mask compliance, we have someone out everywhere they are. When they're traveling, when they're on the school bus, when they're on the sidelines, we have to help understand and have clear protocol to what that looks like so individuals make sure they're being safe. Hope that answered.
Other questions, comments? Ma'am, I'm going to ask you again to please stop interrupting the meeting. If I ask you to leave, you can leave on your own accord or an SRO will escort you out. This is your last warning. Thank you. Other comments or questions from the board? Miley?
Sorry, and if others have questions, I won't ask these, but when we talked about this in August, one of my concerns about athletics was around the other quarantine. So you talked about the 12 students now who are going to be out for practically 2 weeks of school because they were close contacts. Do you know how many quarantines we've had associated with sports or with high-risk sports? Are we seeing greater numbers of quarantines in that situation than for students in classrooms?
So we're still going through the data and tracking the data. We do look at those associated with athletic programs. I don't know we captured that early on, but I have talked to folks to make sure that we're capturing anything related to an athlete. One of the issues was mentioned earlier, the athlete may get or be a close contact, but it may not have come through the athletic program. It could have been they attended the concert that was mentioned, or it came some other way. They just happened to be a student athlete. And so we're trying to work through the best ways we can capture that data without having the data appear to give us results that are unintended, that we're capturing the athletes who went somewhere. And it was mentioned, I will say, there are concerns about students who participate on travel teams. And those travel teams have no restrictions. Some have very high restrictions. And so that is also the possibility.
Mr. Atherton?
Yeah, just to that point, the Orange Rec is fully, just across the street, has soccer, and there's no mask requirements for that, which is listed here as well. We have no control of that, but that's happening as well. How is that contact tracing happening for all the recreation sports that are going on?
I don't know the answer to that because that would fall under the Orange County Health Department. However, I will tell you, we had a very long conversation on Friday There's another call tomorrow with the Orange County Health Department specifically on contact tracing. And I did give several references to, and I won't share those tonight, several references to examples of what that looks like for a nurse in Orange County schools, what that process might look like for what they're doing on their end for non-school COVID contact. So I think they have a better sense, I would say, and correct me, they have a better sense of what that looks like from our, but I can't comment on what it looks like participants across the who are coming sometimes now.
Other board members? Souter?
Do you have any cases of in-school trans?
So as far as secondary transmission in cases, I don't believe, except outside of what's already been reported, I don't know of any additional cases that are directly related to secondary transmission that are related to cases that we, but I will have staff review that. Not clear that any, what to say we have or have not. Staff review had a question.
Doyle?
I have a question about, you made a comment earlier that you believe a couple of contact tracers that are ready to start tomorrow or this week. Because I'm really curious about that. I feel like there are several concerns that kind of overlap that many of us have and have discussed. And one is the burden on our nursing staff and the contact tracing they've had to do. And one is protecting our classroom spaces primarily so that our students can be in school. And we want our sports to be safe for both the players and the coaching staff. And all of these things kind of interact. But I'm curious about the capacity to begin the extra contact tracing by how quickly that could get ramped up by the staff we're hoping to hire.
Immediately. Again, we discussed contact tracers last week. I probably would have had them Friday, and then I was reminded the board hadn't approved it yet. So so we told them to start tomorrow. So we're ready to bring them on. Training is available. There's both online training and direct training. So we can bring them up to speed quickly. So we're ready just as soon as we can get them. Obviously, we have to do background checks and the other information we've been working on, but we're ready to bring on contact tracers immediately. And the reason, let me mention as well, the reason we're able to do that is because this district has a couple things that have been in place for many years. One is our school nurses are an extension of the health department. There's an MOU, and our nurses are funded through the Board of County Commissioners. It's a unique program here. They're not independent school nurses hired strictly by the school district for functions of our needs. So we know the process, and we have a really good relationship because of our school nurses through the health department. The second thing I'll mention is we have an agreement with an agency that helps provide nursing support and staff. So when we have a school nurse that's out or we're looking for candidates, et cetera, they're always ready. That's been in place, and that's been very helpful to us, even just trying to find candidates, or when we have a need, reach out to them. They help vet and do the process, find individuals. So if that, we don't have the capacity there, what we're talking about is regular individuals trained as contact tracers being hired by the district, and we will get them to work just as soon as possible as well. We have a couple avenues where.
Miley?
I understand that this recommendation comes from the CDC's, recommendations and DHHS. I'm curious what we have had what has the local health department, Orange County Health Department, told us about, like, what have they told us that has led to these recommendations?
Sorry, Mrs. Smiley, can you repeat that?
Yeah, the local Orange County Health Department. So did they directly advise us to close these sports? Did they, what did we hear from the health department?
Absolutely did. So they absolutely recommend that we follow the toolkit given. Thank you. Thank you. Okay, thank you so much. Yes, so the Orange County Health Department advised Orange County schools to follow the toolkit with regards to athletics, given the high risk state that we're in. And that was consistent with the ABC Science Collaborative as well.
Like, sorry, specifically, so they said, we think you should shut down high-risk sports because you're in the high transmission.
Well, actually, their recommendation was that we shut down all sports.
Wow.
Well, they singled out sports. What about the other activities? I mean, seriously, because they're all our kids, and I have a level of discomfort with a lot of this. We're 2 weeks in, and we're saying, let's pause. And I regret that we even started to tell them, now you got to stop. And I'm sort of leaning towards not voting for this because we said that we would do testing for the students. We asked about the vaccination requirements and all of these other factors. And I'm sure, are we testing our students? That we said,
Not yet.
well, we said we would do that. Yeah, well.
I think that's part of the 2-week
Yeah, that's
pause.
part of that. That's part of the pause. Well, that's unfortunate because it started and tell our kids to stop. And then it's just some of them. I don't feel comfortable singling out just the athletes. I just don't.
Did the health department discuss any of the other extracurriculars, or is it because it's not as high risk as these particular sports?
They did not discuss. We did not discuss at this time anything besides athletics, given that, again, the recommendation from the North Carolina Department of Health and Human Services toolkit, the high transmissibility, and the fact that we were bringing this discussion back to the board specifically around athletics for this meeting.
Before
I was going to add, the health department did give us an updated recommendation. We'd had the Swim for Charlie program.
Yes.
That was scheduled for all second graders, and based on their recommendation as well, that's been postponed. And we have delayed field trips and postponed. And we did discuss that with the health department as well.
Do I have a motion to extend until 10:30 so we can finish these health and safety?
So moved. Second.
All in favor?
Aye.
Aye.
Any opposed? Okay, we're in session till 10:30. Thank you.
Raise your hands.
Okay, Mr. Atherton, was your hand raised?
Yeah, so I agree. I have a high level of discomfort with doing this, especially, seeing we've already played 4 games and how the coaches, I've talked to many coaches, athletic directors, parents. I just don't see this. I don't see me supporting this. I do support, though, the fans, masking, the spacing, and addressing those concerns that have been brought up, because I do have a lot of concerns about that. That is something we should be doing and protecting, our citizens as well. But that's where I'm sitting at this point.
Hauser?
Agreement. I certainly wish everybody would get vaccinated. We're not talking about the vaccine.
Well, that's all part of this vote.
Yeah,
So.
it's just, but I just think that the data says, I hear all the things that are happening, but the data says of all the things we're doing, sports is going really, and I appreciate the comments on contact tracing. I hope sure you'll be working. But, you know, everything I'm hearing is our kids are really working hard. I feel not be the time that I'd want to penalize. Data says it's.
Ms. Doyle?
I think this is just my personal feeling, and I really appreciate you're bringing like a high bar of the most protective measures, because I think we really do need to consider all these things, especially as we move into winter sports seasons and indoor sports. I mean, these are all really worthy things to consider. And I wish our testing program for athletes was already in place so we could see what some of that, like for example, football data, what that looked like. We don't know that we have multiple cases of football players testing positive for COVID. And since we don't have it in place yet, I mean, we ask athletes to either show proof of vaccination or get a PCR test, and if they're negative, continue playing while we get that testing program implemented over the next couple of weeks. I feel like there are alternatives, and I don't want our alternatives to burden the nursing staff that we have. But I'm not seeing the data that football in and of itself has created extra COVID risk for our students. But on the other hand, I do understand that in the end, it's really vaccines that protect us from large numbers of students having to quarantine and all the close contacts. So there is a connection to that risk, but I'm not ready to pause these sports right now without that data.
So I really appreciate everyone's comments, because I know that while this board does not agree on everything, that we are all here to try to do right by the kids and the staff members of this district. And I did not come here tonight thinking that I was going to vote for a pause, because I really do think that kids need some normalcy. See it in my own kids and their mental health right now, and their engagement in life beyond the four walls of their home are so incredibly important. And I feel a tug because I think that safety protocols are so important, and these are high-risk activities and can affect kids and staff members that are not participating in those activities. And so we're not just voting for ramifications for students, we're also making a vote that affects students that sit next to them in class and get assigned next to them on the bus and at lunch tables. And, you know, I try to not pay too much attention to rumors, but I have heard from several sources and, you know, have some concerns that safety protocols are not being followed with fidelity in these programs, which I believe is why you're asking for these pauses. And that brings me a really serious level of concern. So I am okay, I think, personally voting to continue with sports right now, assuming that we are continuing to pursue testing and possibly, to Ms. Doyle's point, look into asking for a PCR test. I don't know how realistic those things are, but it's certainly possible to have it on the table. But if any of these rumors are substantiated, that coaches are not reporting correctly or undermining the protocols that we are putting into place, I just want to be really clear that I would not have indigestion cutting those programs at that point. So I hope that if anyone is aware of those things, folks will start following protocols really carefully, because this affects more than the kids in those programs, and it is really serious. So that's where I'm at. Smiley?
I want to just appreciate the level of thought and tiering that went into the recommendation. One thought, one thing, even if we do not go for the pause tonight, I will say I would be open to a pause for a week or two on spectators or something. I think some of the I can understand why setting new expectations and preparing staff to support that and everything, distancing and all of those things may take a little bit of time. And I think there has been tremendous risk in the lack of social distancing and the lack of masking at football games. And I think that's something that has to be addressed in order for us to run these things safely. So I would like us to sort of separate the like running the program safely and the how do we have fans safely. And if you need more time to prepare for that piece, I could support that too.
I would absolutely support pausing spectators for 2 weeks while we make sure that we have tight protocols around that and that everyone's clear and we have the staff we need for that. But that's just me. Mr. Atherton?
So I'm not sure there's a need for that. I mean, we had this protocol and programs in place prior where we limited spectators, forced masking, no concessions. In fact, the no concessions caused what we approved in one of our prior meetings because they had no funding that they used to support the program. So, and this recommendation here, I think the lower half of the wearing the mask, the social distancing addresses that. And I think it gives the opportunity for, families to go and watch the games. I'm not sure how that will help preventing that. That's just my point of view because this came up because of the system we put in place to limit the number of people that could attend. And to my knowledge, that's still in place. So I'd be confused on why that would be an issue to implement immediately.
Were there limited numbers of spectators at this point? That wasn't my understanding of what was happening.
No, not currently. I'm saying prior to this season,
Right.
there were absolutely protocols, and that's where the online and how the ticket was done and how they managed it at the gate, all that's been done and put in place. That's why I'd be
Oh, that's
surprised if we didn't have those protocols already defined to be able to do that.
Do you have an opinion about that, Mr. Ebley? Do you need time, do you think, for ensuring spectator protocols are in place?
I think the choice between not having spectators or protocol in schools can respond quickly to that. Have a ticketless option that is available. Just need to work out any barriers parents or individuals and schools have responded to that this weekend is about how to address barriers who may not have a smartphone. To purchase the ticket to work with schools, and student athletes would have all week prior to the competition to assistance from the school to get. So that part would probably be the most difficult. I think signage, we have signage. Again, as Mr. Atherton said, we've already made supplemental arrangements for funding athletic programs without the selling of concessions. Physical distancing, schools will just need to review, calculate, make sure they're clear on the number of individuals. I don't know we necessarily need a pause just for the fan limitation. I think more of the pausing was for vaccination statuses, mask requirements, and protocol procedures for coaches and athletes that will still continue.
And you think that we have the staff at locations to enforce mask mandates for
And anytime a school is holding a venue, not only are they required to have crowd managers at those events, those individuals would be responsible for reminding folks or talking to folks, just as you've done here tonight. I mean, to remind folks and help them understand that to be here, that's part of the.
Right, and that's another moment that I think the board can say, if folks aren't adhering to mask mandates in the stadiums, that's another time where we could potentially bring it back and not have spectators. So I just hope people will really respect the guidelines that we decide on tonight.
What I don't know, and this question was asking me this weekend, what I don't know yet, and again, it's just me getting back and understanding our technical capability. If we have the ability in all of our stadiums or fields, indoors and outdoors, where we can stream the events. We use technology in previous school district. I know some of them have them because when I game the other night, I saw some of the camera systems. So we'd have to do an inventory to say, is every softball, lacrosse field, football, soccer field, where do we have those camera capabilities will not, and so that's another option. All those individuals who want to support Orange County Schools athletic programs but can't game because we're limited and opportunity.
One other
That will take some time.
thing I wanted to bring up about spectators was signage, and I'm hoping that the board can just have a brief conversation about that while we're on this topic too, making sure that the guidance is to only have signs at games that relate to the game being played. That would be my personal preference currently. Does
Can you
anyone
say
else
that
have-
again?
That if there are signs at athletic events, that the signs in the crowds would only be specific to the game or the players at the event. I mean, it's a comment.
Just looking at you as, well,
For me, it's just a comment.
is that possibility?
Have events that are,
Could you use your microphone, please, Ms.
yes, I'm
Stevenson?
sorry.
Thank you so much.
you can certainly have restrictions on the size, the amount, the type of signs, banners, things that people can bring into the stadium. It just needs to be something that, again, you're asking staff to enforce, and it would need to be enforced evenly. But it is possible to say, except for things that are related to game. It is possible. We'd have to, I would recommend that you have something posted and announced.
Does anyone else have thoughts on the topic or on any of these safety measures? I'm not sure that we actually need a vote on most of this. Mr. Atherton?
I was going to ask, do we need a vote?
I think that's an Eva question.
On which item?
Just about since we
About-
are not mandating vaccines,
Right,
it doesn't
but-
sound like that's the consensus. Okay, Ms. Hauser?
I just have a question about, in addition to this, can we get a report on things we can do safety in our elementary schools, where we are seeing a rise? Especially interested.
In mask, like, are you worried
Masking?
about?
In mask
You said earlier
compliance,
about,
our elementary schools, because I'm looking at cases 11. So I'm, something about that.
get the FDA to approve the vaccine.
That's not going to happen. It's not going to
Under
happen.
EUA.
Which is why this is more important.
Yeah.
Parents don't have it.
Board?
Well, so back to your sign comment, are you saying that that's not something we need to vote on because that's something that?
It's an operational
It's an-
decision. I
okay.
believe that Dr. Felder can make that if she chooses. I mean, I was just giving feedback, so
Another idea would be the size of sign. So there's like size of sign, there's, content of signs or whatever. So there are different categories and you're suggesting that Felder and her staff. Okay.
other thoughts?
You also asked if there needs to be a vote on sports, and I do think so. There doesn't need to be a vote. I mean, if there's not a motion for the pause, then there's not a motion. But my understanding is that the second category here, which is masking indoors and outdoors, physical distancing and limiting attendance and no concessions, is not the status quo. So I think the question is there a motion to adopt those rules or re-adopt them for all sports?
And I have one just slight modification,
Okay.
just so we're clear. The recommendation for basketball, wrestling, and competitive cheerleading included only having the mask off the field of play because that would have been tied to a vaccination status requirement. So we would just modify that. Football would require off the field of play because of the guards. That's the safety. We would go back to the safety standard. Other sports, especially two of those are indoor, it would be required on and off. So I would make a modification to the motion.
So that's, so what you're saying is, that's kind of a separate issue, that the administration is recommending that participants in football, basketball, wrestling, I'm sorry, yeah, football, basketball, wrestling, cheerleading must be vaccinated in order to participate.
No.
That's, okay. Not, not
That was what we brought. I'm not taking that,
okay.
voting on a motion that yet.
In which case, if that is not going to be required, then the masking would be required.
That's
Right.
correct. We would need to make a
Right. Correct.
modification to everything else.
Correct.
Not taking that. Bans and other limitations, mask requirements, recommend be approved as presented,
I see.
except for basketball, wrestling, and competitive cheerleading.
I see.
Do I have a motion?
So motion to approve the fan and other limitations with masking requirements for the athletes.
For what?
Fans and other limitations and masking requirements for the athletes. That's the secondary recommendation, not the primary.
Okay, all right.
Can I just point of clarification?
Yeah.
Will, you're saying the fans to include the limited numbers as well as fans being masked?
Yeah, so I'll
including both.
read, I don't mind reading it
Okay.
for
Read it.
clarity. So motion to approve fan and other limitations, all fans must be masked both indoors and outdoors, physical distancing required by non-household members, attendance limited to parents or guardians, no more than 2 of athletes only, no selling of food items or concessions, masking requirements for athletes, required off the field of play regardless of vaccination status.
And just
And
for clarity,
required.
it wasn't just parents, it was like athletes can choose to.
Right. And I
People.
think, yes, and what he's requesting is also for that second part, required off the play regardless of status and required on the field of play, basketball, wrestling, and cheerleading.
So amended.
Are you adding that to your motion?
Yes, so amended to include that.
Is there a second?
Second.
All in favor, show hands. Aye.
Aye.
Any opposed? Okay.
I
Motion
have, I'm
passes.
sorry, one more point of
Yes.
clarification. And I'm sorry that we didn't address this before you made the motion. Will that apply to all sports?
Well, I was getting ready to say, since that, the motion was read for the high-risk sports, for consistency, do you want to go ahead and do the next 2 categories as presented?
Yes.
Everyone is comfortable
For
that that was for all
consistency.
sports?
Yes, that
Okay.
was the intent.
And since that was all sports, yeah,
Great.
yeah. Mr. Atherton?
So I just have one clarity. I mean, this was all come about because, of our high transmission rate. I assume over time, as we see this change, there'll be other recommendations to change this, to allow more spectators, to allow concessions, et cetera.
Absolutely.
Thank you.
Okay, so our next item is new staffing requests. Hatcher?
Yes, so Ms. Hatcher?
Come.
Board Chair, Vice Chair, Superintendent Dr. Felder, and members of the board. I come before you this evening to request new staffing requests. Many of these positions have already been talked about this evening in various presentations. And there are 4 positions that we are requesting. Actually, yeah. Next slide, please. I don't know who's still turning slides, but I'm going to go ahead and move forward. One of the requests is a floating nurse. We have this evening for the nurse, for additional nurses. As Mr. Abley stated earlier, we are working with an outside agency to help us staff this position. Also with the contact tracers, we do have 6 positions that we're requesting. 2 positions have already been. And then there's our bus driver director, stated early on, the 20 additional bus drivers to help us get our students safely to school. And then we would also add or ask that there be added to our bonus 3 school psychologist positions, one of which is a lead psychologist position, and this would be an additional $10,000 bonus that would align the positions that we have in our recruitment. So these are the staffing requests that we're asking for this evening. Again, this would help us, these additional positions help us to support student achievement, as well as ensuring the safety and the well-being of staff and students.
I have a question here. The supplement. Well, and I'll just speak up on the vice here. So my question is, I think I know this, but I just want to say it for clarity. The bonus, the $10,000 bonus is going to happen over time, correct?
Yes.
Yes, ma'am.
All right. Yeah.
Recruitment
I was
It's a recruitment bonus.
right. But I wanted to say that because so many people, think we were going to give somebody $10,000 and then they'll quit
No.
in a month.
And I want
It
to,
doesn't work that way.
I'm sorry, I didn't mean to cut you off.
That's all right. No.
I do want to add as well, this is part of our ongoing recruitment process that we already have in place.
Uh-huh.
This position is being paid with correct ESSER fund. Positions bonus will run out in 2023.
Right. Bonnie?
I have a couple questions. One is on the bus drivers in particular, that it's so difficult. Every district is having trouble with it.
Can you get closer to the mic,
Oh,
Bonnie?
sorry. I'm particularly worried about the bus drivers because it seems to be a shortage everywhere. And I think Mrs. Doyle sent us something that said that Durham is now offering very high salaries, $4,000 bonuses, and full-time employment, 40-hour-a-week full-time employment, which means benefits for bus drivers. Did I read that correctly? That's what I read. So I just didn't know if what we're doing is what we need to attract the bus drivers. And then the second thing is, are we looking at the option of a referral bonus to get more employees involved in helping us find qualified people? So if you find someone, you get a bonus too.
I'm going to refer to driver director that is sitting behind me because I'm being asked these questions. He can help me with these questions. I do know that we do have some incentive programs set up around our bus drivers. We do have some incentive programs set up for our bus drivers. I do know that there are, I can remember off the top of my head that there are some attendance bonuses that are tied to when we recruit our bus drivers, as well as, I know attendance bonus was one. I do know we do a sign-on bonus, thank you, and retention bonus. I do think that it would, if we do not have the referral bonus, not only just for bus drivers, that may be something good to add in all these areas to help our organization and also help and have our current staff involved in our recruitment efforts. Sure.
Would also say all of the costs associated with commercial driver's license and training needed to become a bus driver is paid for the district as well. And we also help them with their medical certification, helping them achieve that requirement also. And as far as the bus drivers, back to the earlier point, I just wanted to make those 20 bus drivers, we will be prioritizing those for elementary schools to help with our physical distancing and our with what was mentioned.
So I'm so happy to support all of these positions, but I want to just also throw in there, I know that our staff in our school buildings are exhausted and don't have lunch breaks, and their their planning periods are being used for PLC and PD. And, if we can utilize bus drivers to cover lunch shifts or something like that, I am open to creative use of folks coming in. So I'm just putting that out there to you, Ms. Hatcher. I also just wanted to mention that Dean of Students, and I'm glad Mr. Albert's here because the tool allowance also we had added to this agenda item. So before we vote, I just want to make sure we cover those two things.
Mr.
That-
Atherton?
That was my exact point, that
There you go.
when it was reviewed, we included the tool allowance at the beginning, so that would be as well. And my understanding is there would be two payments, a 500 and a 500, beginning of year and middle of year kind of thing.
I'm supportive of these things, so I could make these comments afterwards if you want me to, Madam Chair, but I wanted to comment on the starting salary of our school nurses. I've been told that our school nurses, even though they're master's level with RNs, they started a beginning teacher salary, and they have to wait till they have their school nurse certification, which takes 2 years before they get bumped up and their master's level training gets recognized. And so we're trying to fill nursing vacancies and even add a floating nurse in the middle of a nursing shortage, and they're working overtime. And so I would like to see a proposal to raise the starting salary of our school nurses to recognize their master's level qualifications and to provide that recognition for the time it takes them to earn their school nurse certification.
Bring that back to a future agenda, just so that we have all the budget information for that, but I support that also.
Before you call on Mr. Atherton, I would make a motion to further extend.
It's your favorite thing to do.
My favorite thing to do. I love staying here. Do we want to do it for 15 minutes or 30 minutes?
Yeah, 15 minutes.
All right, 15 minutes.
Second.
Extension.
All in favor?
Aye.
Any
Aye.
opposed? Okay, we're good until 10. Or shorter. Okay.
I love you, but not that much.
So
We'll have
the
to-
students and tool allowance. Oh, Mr. Atherton, I'm sorry.
Sorry.
Nope.
So I just wanted to echo also what Ms. McKenzie said about looking at additional staffing and potentially using bus resources so they have a continuous day versus a big break. Also, on the mastery program, there are other positions where they're not given that. So I think that's one item we need to look at. And the last one that we've brought up many times is years of experience, right? Only counting in Orange County. So through the budget committee, we will definitely bring these things up and start looking at, the implications and how we would consider those.
Thank you. Shall we start with Dean of Students? No, I mean,
No.
is there something that
We need to talk about it before we vote on it.
didn't seem like there was clear consensus on it in
Right,
closed
well,
session, so.
Well, I'll just kick it off because I know that I initially said that, I understand if Cedar Ridge is interested in having a dean of students and repurposing the AP for that, I have a level of discomfort with Orange High School, us going into fund balance to get a dean of students that we had before at Orange High, and that community decided they didn't want it anymore, but to go into fund balance and to fund a position out of fund balance, because that's just not good operations. You just, over time, I've been taught, you just don't fund positions out of fund balance, not unless, of course, it's not going to last but a year.
Right. So thank you so much for bringing that up, Mrs. Stevens. So a point of correction, the position would not, for Orange High School, would not be funded out of fund balance. And Ms. Rath can speak to this further. That was an error. It would be a reallocation of local funds, not fund balance.
Well, how would we sustain the position?
We'll welcome Ms. Rath.
Good evening, thank you. It's a good question. The intent would be to look at our local budget and to massage and reallocate and transition funds where we are running under to be able to support the position going forward or for the amount of time that's needed for the position.
Other board members?
Just, I have we things that we're doing to help with bus drivers and safety protocols, we're not doing any of that for instructional support for the day-to-day operation. Is it possible for you to come back with a recommendation to add staff to this to help them get through this? Talking about all the stress our teachers are under, we're not doing anything.
This would be a position that would support.
The dean of students. Yes,
Yes.
I switched subjects. I'm sorry.
To Ms. Howard. I know it was mentioned earlier today. Mentioned this evening.
Use the mic, please. Thank you.
I do know that was mentioned this evening around central office staff supporting our schools. So one of the documents that has been created that we're looking at, and Dr. Dawson and Mr. Abley are working on that document, is a document to provide support to our schools. That would be central office staff. That would also be perhaps bus drivers, instructional staff, who are not necessarily in instruction, but they would come in, for example, answer telephones, help and provide that extra level of support where we're hearing that our staff is just overworked, overtaxed. So we are looking at such a document as such to help with some of these. I know these are positions and we do need those positions, but we are and have considered and are looking at additional support to help our staff.
If I may add, and thank you, Ms. Hatcher, for that, to include, much like we did last year, leveraging central services staff to support in the role of substitutes. So we rebooting that list, as well as how we can further support our school nurses, office staff, et cetera.
Smiley? No. Anyone else? Do we have, Mr. Atherton?
So I would just like to say, I would be willing to sign up on that list to help when I can. I mean, I work, but I'd be willing to sign up to help whenever I can to watch kids or do whatever. It doesn't require licensing, of course.
Yeah, me too. Me too. Incentives are good enough. I'll go get my CDL.
You do understand the board member.
Oh, yeah, you're
No,
right.
no, no, no.
God,
I
right.
meant
I know you.
volunteer.
If, while we're on that topic, if I just may, I mean, one way that you can be of support certainly is to relieve staff of some of those extra duties, such as being on the car rider line. Those are opportunities where you certainly be of support.
Great, thank you, Dr. Felder. Do we want to hit on the tool allowance before we vote? Yes, we
Do you what? I didn't hear you.
Sorry?
What did you say?
I think that we need to discuss the tool allowance.
Oh, yeah.
And then we'll
Yeah.
have a vote. We didn't really discuss it in closed session, so
Right.
if Mr. Albert could
Yes, we did.
talk to us about that, that would be very helpful.
Yes,
Hello.
ma'am. Hello again, everyone. Any questions that you have for me, or would you just like for me to explain what this request is really for?
I think for the public listening, it would be helpful to have a broad stroke of what we're voting on.
It's like any other trade, whether it's carpenter, landscapers, things of that nature. Any special trade requires their own special selection of tools, whether it be lawnmowers, hammers, skill saws. In this profession, that technicians provide a service for. School system is technical tools, hand tools to work on buses and county sport vehicles. These tools are tools that you can't go to Walmart, Home Depot, Lowe's, anything. These are not off-the-shelf items that you can find. These are specialty tools that you have to order, buy from special vendors and things of that nature. So these tools can be very, very, very costly. Choke you. How much money that a 20, 30-year veteran has invested in it. There again, it's an incentive to try to keep these technical employees with the tools that they need to be efficient, safe, and to keep them retained. High quality technicians are hard to find, and it's a good incentive to help retain them as well. A lot of purposes and tool allowance.
Mr. Atherton?
I just want to reiterate, the school district does not pay for any of their tools today.
No, sir.
They walk onto the job, we're expecting them to have $30,000, $40,000 worth of tools and to maintain it on their current salary.
Yes, sir.
I just want to say that out loud because it's not obvious.
That is 100% correct, sir. Make that very clear as well.
So I would ask Mr. Albert if you could just explain why, I'd like everyone to understand why mechanics and technicians bring their own tools. I understand that that is a request that they have, not wanting the district to those tools available for them to use. They would prefer to purchase their own.
Yes, ma'am.
Common practice in other districts.
A technician with their tools is, and I don't want to get too far in the weeds with this, but it's like maybe a lady in their pocketbook or their makeup box. You don't really share that. So these technicians don't share their tools. The tools can get
Then we
lost.
can understand.
But you don't share these tools because one, they're expensive, and if someone does not buy them, they don't really take as good care of it as they would if they had spent money out of their own pocket to buy these.
Thank you, Mr. Albert. I have been down to the garage and they are very impressive toolboxes. And I think it's safe to say that the board is really excited to support your staff.
Awesome.
And
Thank
we
you
know
very
how
much.
hard they work. And the nice benefit.
Madam Chair, so we buy these tools and say, said employee resigns in a year, do those tools stay with us?
No, ma'am.
They get to have them.
So it's a benefit. It's
It's
an
a
employee
benefit, but it's great incentive, but if we buy these expensive tools, we want to keep them, we want to keep that employee at least a year.
I spoke with a neighboring county, Person County.
Yeah.
And they have a tool wall, if you will. So they try to put some specialty tools on the wall and do it that way, but it does not work. The tools walk off and they leave.
Oh, boy.
It's hard to find the good or the bad there, but
Are there
other entities do these tool allowances and it works.
Okay, cool. Any other questions or comments before we vote? Thank you so much for being here, Mr. Allen.
Yes, ma'am. Thank you.
Do I have a motion?
Motion to approve the new staffing requests
Second.
and the tool allowance.
All in favor?
Aye.
All opposed?
When you say, I have a question. When you say staffing request, that includes everything we talked about? Because
Yeah, the motion was intended to
The dean,
include,
'cause I
include
can't
the
vote
dean
for
of
it, 'cause I
students
don't-
roles.
Okay, because I'm not voting for the dean part, so I just want.
That's a nay from you,
Yeah, you
right?
can say no.
So I would like to clarify, so because there's different things, say,
Yeah.
dean of students, floating nurse, bus drivers,
Contact tracers,
It is so much.
the recruitment
contact
bonus.
tracers, and additional,
And the tool allowance.
and the tool allowance. Okay, there is a reference on the attachment to the Plan Academy already approved.
Yeah.
And to it. Is that on the personal? Or has that already been approved? Sorry.
For clarity, OCS online data manager position.
Okay, that was on the personnel.
It was.
Okay.
Yeah.
We're talking dean of students, contact tracers, floating nurse, recruitment bonuses.
Good? Have the clarity we need?
That's what's in the motion.
Yes. Okay. Well, with that, I want to thank everyone for being here
Oh, yeah.
tonight. This was a long one and an important one, and we are really grateful for everyone. With that, I will take a motion to go back into closed session because we have, what? Did we not vote? I thought we just
got
voted.
one more thing.
Sorry, what am I?
You want to go back into closed session?
That's what I said.
Yeah, that's what we said. Oh, sorry, no.
I mean, it's 10:45. I don't know how we're going to start the data.
Okay, I just wanted to be clear.
I mean, do you,
Okay. Okay.
I mean, there's no way to have that conversation with any heat to it. Okay.
You want-
So is there a motion to go into closed session?
Madam
Yeah.
Chair, just, sorry, one clarity, there's some confusion here.
Yes, okay.
And they're trying to record what happened and
Okay,
just make
let's, okay,
sure.
we're pausing. We're
So
pausing.
I believe there was, everybody voted yes, Ms. Stevens was the dissenting vote
Yes.
on the last.
Yes,
item.
she was the one dissent.
Everybody voted yes, Ms. Stevens was the dissenting vote.
Yeah, and just be clear in the minutes, because I totally support all of the additional positions. I was just not in support of the Dean of Students for Orange High School. I was on the board when we decided not to do it.
Ms. Doyle?
I was just wondering when we think we'll have the accountability and the state accountability and the strategic plan. Will it be the next board meeting, or will we have a special meeting before then, or?
I mean, I guess
Good,
we just
decide
need to
that.
have a follow-up conversation
Okay.
tomorrow. I just know that we can't start
Gotcha.
such an important conversation at 10:05. Okay. Is everybody okay with that? I mean, I don't know.
That's fine. That's fine. I just wanted to ask.
Okay.
Yep.
Motion to go back into closed session?
So moved.
Second.
All in favor?
Aye.
Any opposed? Okay. Thanks, everyone.